Hello, everybody. My name is Carmel Saad, and I'll be one of your facilitators this afternoon for the Breaking the Bias Habit, um, along with Jared. And just a little bit about myself. Um, I'm an associate professor of psychology at Westmont College, and I also have my own consulting company called Carmel Saad Consulting. And I just wanted to express, I'm really honored to be here with you today. We've done this with several organizations, but it's really meaningful, I think, to do it with healthcare workers, especially in this time. So thank you for taking the time to participate today. A little bit more about what I do. I do a lot of interactive trainings around these issues, implicit bias, multicultural awareness, cultural competence and proficiency, but also diversity, equity, inclusion, and justice. And when I say interactive, I mean it, because all the research shows that good implicit bias workshops don't just raise awareness about what implicit bias is and the impact it can have on behavior, but also equip participants with evidence-based strategies to disrupt the impact of bias on their behavior and a chance to practice them. So that's exactly what we're going to do during the second half of the workshop on Thursday. Is we're going to introduce you to the strategies and give you an opportunity to practice them. There's a lot of implicit bias workshops. I mean, the amount of implicit bias workshops has exploded in this country, especially recently. And a lot of people think that you can go to a one-day implicit bias workshop or a two-day implicit bias workshop and walk out unbiased. And that is not true. That's like going to the gym for one day and walking out fit. These things take a lot of effort and energy and practice. And to be honest with you, all the most recent research shows that you can't really change implicit bias. You can push it around in the short term, but not in the long term. So where does that leave us? It leaves us with relying on these evidence-based strategies to at least stop implicit bias from leaking out onto our behavior towards others, which is what we really care about anyway. So even if we don't reduce levels of implicit bias itself, at least we can disrupt the impact that it has on our judgments and decisions when it comes to other people, which is just as good. I'm also a researcher by training, so a lot of my work with the consulting firm focuses around data collection, analysis, interpretation, and visualization, as well as program evaluation on various organizational processes and outcomes. I also want to say that a lot of people don't like to go to any type of diversity workshop because they think they're going to be shamed, blamed, and called a racist. This is not that. This is really about raising awareness about implicit biases that we all have and practicing together the strategies that have been shown to be effective in reducing the impact of those biases on our behavior towards others. So I just want to say thank you again for joining us today and Thursday, and I'll turn it over to Jared.
All right, good afternoon, everyone. I want to welcome you as well. Again, my name is Jared Schwartz, and I'm the founder and principal of Equity Praxis Group. Equity Praxis Group is a mission-driven consulting practice that aims to help individual leaders, organizations, and communities be able to talk meaningfully about issues of diversity, inclusion, equity, and justice, and be able to take concrete action to create positive change in their lives, their organizations, and ultimately our world. Personally, I've been doing work around these issues for about 30 years of work. Do work with healthcare providers, educators, nonprofit organizations, businesses, media, government, really all sectors of the community. But it's particularly meaningful for me to be able to work with healthcare providers. I was diagnosed with a chronic illness when I was 10 years old and struggled with it actually even for a couple of years before that, before they figured out what was going on. And so I know firsthand what it means to receive not only good quality healthcare, but to really have people take you seriously, to have healthcare providers take you seriously, take your parents seriously, and be able to respond in ways that build trust and build connection and rapport, and really to be able to find healthcare providers who serve the entire person. So, I want to thank you for taking the time to be with us today. And we look forward to working with you throughout the afternoon today and and on Thursday. So just to share a little bit about what we're going to be doing with you, we've divided this workshop into two sessions, this afternoon and Thursday afternoon. And we've also divided it into 3 sections: the what, the so what, and the now what. The what is really focusing on what is implicit bias, what is unconscious bias, and how is it different from overt or conscious bias. We'll also get into the social science behind bias and the brain science behind why human beings are so susceptible to it. We'll then move into the so what. In other words, why is this important? Why do we need to understand implicit bias? What's the impact of bias on our decisions, our thinking, our interactions? How does implicit bias affect different groups of people? And how does it play out in various sectors of society, from education to law enforcement and other areas as well? And we'll play particular focus on how implicit bias plays out in healthcare in ways that undermine both access and outcomes. And then on Thursday, we'll come back and really focus in on the now what. In other words, now that we understand what implicit bias is and we understand how it can negatively impact health outcomes and access, what can we actually do about it? What can you do as individual healthcare providers and professionals and as healthcare educators? And what can our healthcare institutions do to decrease the likelihood that the implicit biases that all of us carry around with us will be less likely to impact our behaviors, our interactions with patients, and ultimately less likely to cause problems for the health outcomes that we want to produce. So that's how the workshop is broken down. Again, today we're going to be focusing primarily on the what and the so what, on Thursday on the now what, and we're looking forward to taking this journey with you.
So I'm going to talk a little bit about the changing landscape of bias in the United States. So we have a history of bias in this country that has evolved. So here are some data showing this changing landscape. And it's data ranging back several decades, all the way back to 1935. And it's showing how Americans feel about various social issues when they're asked about it, at least on an explicit or conscious level. So here are some of the social issues they were asked about. The blue line at the bottom represents approval for interracial marriage. So you can see it's really skyrocketed over the decades. In fact, in 1958, it was at 4%. In 1997, it was at 50%, and today it's at 87%. The yellow line in the middle is showing something similar. So this is opposition towards laws against interracial marriage. So in other words, support for interracial marriage. And that's gone up dramatically as well. The green line at the top is showing support for racial integration in schools, and that has also gone up dramatically. In addition, racially motivated hate crimes reported to the FBI fell by almost half between 1994 and 2015. So this is painting a very rosy picture of how Americans feel, at least on a conscious or explicit level, about social equity. They want more egalitarianism in this country. Despite this, however, there are still a lot of disparities across a wide variety of sectors. So there must be something else going on. So Jared's going to talk a little bit about, this push for wanting more egalitarianism, more diversity, but later on we'll reveal how that's not necessarily being materialized in outcomes for all groups in society.
So as Carmel said, on very specific kinds of questions, people in the United States are reporting that they want more equality, that they want better outcomes for people. And in general, people are saying that they value diversity. According to a Pew Research study in 2016, the majority of people in the United States say that diversity makes their country a better place to live. And you can see that this is especially high compared to people in other countries who don't rate diversity as being as valuable. In 2019, a similar study showed that all adults tend to say that diversity is very good for our country. And that's true for white people, for Black people, and Hispanic people. You can see that 76% of all adults think that diversity is something that's good for our nation. And so if we know that on individual types of questions, people have perspectives that are promoting, they're valuing diversity and equity, and in general, people feel diversity is good for our country. The question is, why aren't we seeing the outcomes that we want to see, that people report wanting to see?
So here are some state and national trends that reveal some of the disparities that I was talking about earlier. So right here in California, there are racial disparities by who gets a 4-year degree. So white Americans and Asian Americans are significantly more likely to complete a 4-year degree compared to Black Americans, Latinx folks, and Native Americans, as well as this combined households of color category that they have. When it comes to medical insurance, we see that Hispanic Americans and Native Americans are more likely to be uninsured, as well as this combined households of color, compared to white Americans, Black Americans, and Asian Americans who are more likely to have medical coverage. Nationwide, when it comes to people's livelihoods, we see that white Americans and Asian Americans are earning significantly more compared to Latinx households, Black households, as well as this combined households of color. So even though people are reporting that they want more egalitarianism and they want more social equity, when it comes to actual outcomes, we see racial disparities still. So there must be something else driving it if it's not people's explicit attitudes, because those explicit attitudes are more egalitarian. So that's what we're going to focus when we talk about implicit bias or unconscious biases that people aren't aware of, but leak out onto our behavior and create these disparities.
So looking at this another way, this chart is comparing the likelihood of having a bad outcome in the United States. It's comparing African Americans in the red line and white people in the black line. And it's looking at a range of sectors in our society, from healthcare to education, criminal legal system, child welfare, and finance. You can see going left to right that African Americans are more likely to have a bad outcome when it comes to infant death rates, death from diabetes, below proficiency in 4th grade, suspensions in K-12 education, the likelihood of being searched on a routine traffic stop or being incarcerated as an adult, the likelihood of being identified as a victim in child welfare, being in foster care, being denied a loan, or not owning a home. And so again, it begs the question is what's going on in our society that in every sector, according to all these measures, white people are always more likely to have a better outcome. So there was a landmark study in 2002 called Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare. The Institute of Medicine put this out. And they found a range of healthcare disparities between people of color and white people across a wide range of diseases, disease areas and services, across a range of clinical settings from public and private hospitals to teaching and non-teaching hospitals. They found that these disparities existed even when access-related factors such as insurance status and income are controlled for. So it didn't matter that, this was comparing people of similar incomes and people with health insurance and without, but kind of at similar states. They found that even when clinical factors are taken into account, these disparities persist, and that they're often associated with higher mortality rates for people of color, for minorities in general. That was in 2002. Another study was done in 2018 that found that in those 16 years between these two studies, the gap between whites and African Americans, Hispanics, Asians, and American Indians and Alaska Native had either remained the same or worsened for more than half of the core quality measures being tracked. So again, the question is, if we know about it, and if we don't want these disparities to exist, what stops us from being able to close these gaps? Now, we're not saying that implicit bias is the cause of all of this, but what we want to look at is what role has implicit bias played in helping to create and maintain these gaps, and how by addressing implicit bias might we do a better job of closing them. That's what we're going to explore throughout our time today and on Thursday. So just a little bit about common language. One of the things that's important to help us talk about this is to be able to have a common language through which we can talk together. I also did see actually a question in the comment box that I'll share in just a little bit, but I want to go through this piece on common language first. So a couple of the terms that we've been using already, one is diversity. So when we're talking about diversity, we're really just talking about the demographics of a particular group, organization, community, society, etc. In other words, how many people of this identity, how many people of that identity? It's really just about the numbers. It's what's the range of similarity and difference within a group. In this image, for example, we can say that there's one blue person, one red person, and one yellow person. Now that's one aspect of their diversity, but again, it's something that we can count, it's something we can measure, and it's just the reality of what is. There's a blue person, a red person, and a yellow person. There's no valuing, no value placed on that. It's just kind of what is. Inclusion, on the other hand, is what do we do with what is? In other words, it's if diversity is about the people and who the people are, inclusion is how are we treating the people? Are we treating them in ways that make them feel valued, respected, seen, heard, and like they belong? In this picture, we can talk about which side of the fence are these people on? Are they on the inside enjoying the game, either as spectators or as players, or are they on the outside looking in? That's what we mean by inclusion. The next concept is equality. When we're talking about equality, we're really talking about giving everyone the same thing. In this image, it's giving each person one box. We have 3 boxes, we have 3 people, so let's be equal and give them each one box. Well, that works out really well for the blue person. For the yellow person, one box doesn't help them see at all. They still can't see over the fence. And for the red person, one box helps them see over the fence, but you can see they're pulling themselves up and they're still straining to look over the fence. They're standing on their toes. Eventually, they're going to get tired. The next thing we can look at, though, then, if equality doesn't get us to where we want to go, what about just providing supports and services as people need them? In other words, in this picture, let's give the blue person 1 box, the red person 2, and the yellow person 3 boxes. That helps each of them see over the fence. In society, that might look like giving tutoring to students who are struggling in school, giving scholarships to people who want to attend higher education but can't afford it. It's kind of identifying what's the immediate need that a person has in a given situation, and how do we fulfill that need? Now, that works really well, and it can be really important in making the difference in that individual's life, but it doesn't address the larger societal barriers and obstacles that many different people face. To get there is where we start talking about equity and justice. Equity and justice is about first acknowledging that barriers exist for different groups of people, and then addressing those barriers. So in this picture, equity and justice is about recognizing the fact that the ground underneath these 3 people isn't the same level, that the blue person is standing on higher ground, which gives them an advantage over the red person and the yellow person. It's also acknowledging that the fence is not the same height in front of each of these people, that the blue person has a lower fence, again, giving them an advantage over the red person, and the red person has a slightly lower fence than that in front of the yellow person. So equity and justice is about recognizing that these kinds of barriers, they're structural barriers in society: racism, sexism, classism, heterosexism, genderism, ableism, ageism, all these isms that create structural and institutional barriers to opportunity, access, and success for different groups of people. And equity and justice is about acknowledging those barriers and then doing something to address them. In other words, how do we level the ground beneath these 3 people? How do we level the fence? Could we change what the material that the fence is made out of to make it clear so that they could see through it? Or could we do something to bring them on the inside so that they're no longer on the outside looking in? So we want to stop there for a minute and just see first if there's any reactions or questions coming up related to the image and how we're defining the terms. And I see, while you're thinking about that, the question that I got was, should we be referring to ourselves as Americans only as opposed to African American, Mexican American, et cetera? We're going to talk about this a little bit later, but when I was growing up, I was a child of the 70s and 80s, and the thing that I learned was we need to be colorblind. We need to kind of not see each other's, color, race, gender, things like that. And in theory, that sounds good, except what it does is if you don't see who I am, if you don't see my race, my gender, my sexual orientation, then you don't see all of who I am, and you don't necessarily understand the experience I have in the world. And especially if we know that there are huge disparities between people of color and white people in health outcomes, for example, or between LGBTQ people and straight and cisgendered people, if we don't look at those differences in identity, we then also don't see the disparities, and we can't then address them. So other questions or thoughts that may be coming up?
One thing that I'll just comment on is, for me, it seems like the uneven ground underneath is kind of representing the historical and systemic um, inequality that we start off with. So really addressing the institutional and systemic is kind of allowing everyone to start on an even playing field, as well as making the fence even as well. But that's more of what I think in terms of, provision of services and support. So you give people what they need, one boxes versus two boxes versus three boxes, but what can we do to also make the fence more even?
And someone to respond to me, kind of, don't we all have some disparity in some way? And absolutely. I mean, I shared before, I had a chronic illness growing up. That was certainly an obstacle for me. I was also white and straight and from the upper middle class. And so those things actually helped me with my chronic illness. My parents had insurance. My parents had the means to take time off of work and to take me to hospitals and to drive me to, out of town to other places to get examined and to get looked at and to try to find a specialist who could figure out what was going on for me. When I was, in a hospital and screaming in pain and no one was, figuring out how to help me, my parents could express anger without fear that security was going to be called because of the color of their skin. So there are all sorts of ways that each of us kind of carry burdens in the world and have our own challenges that we have to overcome. And there are also ways in which society is set up to give some of us some extra opportunities around those burdens, or to make those burdens a little lighter, and for other people a little heavier. And so that's part of what we want to look at today.
Okay, so now I'm going to talk a little bit about the science of bias. So why is it that the brain gravitates towards these stereotypes and biases in the first place, to socially categorize people? So I'm going to talk a little bit about stereotypes versus prejudice versus, stereotypes versus prejudice / bias versus discrimination versus oppression, because a lot of people use these terms interchangeably, but there is a difference. Stereotypes are just cognitive associations. So you take a trait or a characteristic and you slap it onto a whole group of people, even though it may not apply to them. So for example, if I say, people from the South say y'all, that's a stereotype. So I'm associating a trait or characteristic or behavior with an entire group of people, even though there's plenty of people from the South that don't say y'all, and there's plenty of people not from the South that do say y'all. So it's not necessarily accurate, but it's an association that's given to us by society. The second that you add an emotional or an evaluative component, then it becomes a bias. And we do use bias, prejudice, and attitude interchangeably. So a bias is, like I said, you're adding that emotional or evaluative component. So if I say, and I think they sound stupid, now that's a bias because you're evaluating, you have a preference for one social group versus another. If I then say, and I'm not going to offer them this job, then that's discrimination because it's actually affecting my behavior. And then if a group receives enough discrimination from enough other people in society, then it's widespread discrimination, which we refer to as oppression. So, I oftentimes use this image of an iceberg because a lot of people think that our conscious attitudes predict most of our behavior. But in fact, our unconscious attitudes predict a lot of our behavior as well. But they're submerged under the surface. So in that way, they're particularly insidious because, a lot of our behavior is driven by these unconscious biases, but we don't know what they are. We don't know how they affect our behavior. In fact, some researchers think that we start to absorb these biases as early as age 3. So very early on. And they are most likely to affect our behavior when we are tired, distracted, stressed, rushed, fatigued, busy. Anybody here busy? No? Great. No, of course, we're all busy. And so we should recognize that that's when these biases are most likely to impact our behavior. So, when we are depleted in those ways, tired, distracted, busy. So just like we tend to fall back on other bad habits when we are depleted, like, biting our fingernails or smoking a cigarette, when we're depleted in those ways, we also tend to fall back on these other bad habits. So, for this reason, researchers call implicit bias a habit of mind. But the nice thing about thinking about it as a habit is that it can be replaced. It can be broken and be replaced with better habits. So again, when I talk about bias, it's really a preference, and some are explicit and some are implicit. So if I asked you, do you prefer Pepsi or Coke? You would think about it and you'd give me an answer. But you're aware of that. That's your conscious bias. But a lot of these unconscious biases or implicit biases can impact our behavior unknowingly, and in a habit-like way. All right, so now I'm going to do an activity. So by show of hands, either virtual or physical hand, how many people think that square A and square B are different colors? Okay, quite a few hands. All right, so you can put your hands down. By show of hands, how many people think that they're the same color? Okay, few people. Why, Irene, have you seen this before? Irene sat in on another workshop we just did today, so she knows about this. So would you believe me if I actually told you they were the exact same color? So I'm not going to do anything to the image itself. I'm just going to take away parts of the slide. Ready? So now you can see they're the exact same color. So why do they look so different?
Our mind is playing tricks on us because we are allowing unconsciously the shadow created by that cylinder to interpret what the colors are versus rather than what they are.
That's exactly right, Brian. And you're also right, Irishman Pat. I'm assuming Pat. It's the shadow effect. So we grow up in a world with shadows. And so from a very early age, we learned this rule about the physical world that anything in the cast of a shadow is lighter than it appears. That's not the case with this particular stimulus because this is a visual illusion and the shadow has been messed with. But nonetheless, even though, even if we have never seen the stimulus before, we just automatically apply that physical rule without even thinking about it. Stereotypes and biases work in exactly the same way. So if I encounter a new social stimulus, a person, I will apply the same rules from my social environment that I grew up with. In this case, stereotypes and biases. So for example, if I meet Jared for the first time and someone tells me that he's Jewish, but I don't know anything else about him except that he's Jewish, what I really should do is take the time to sit down and get to know his family, his background, his personality, his goals, his aspirations. The problem is we live in a very busy world. So right now, I'm bombarded with all sorts of stimuli. So right now I'm paying attention to the words that I'm telling you, to the light coming in from the window, to the temperature in the room, to the noise going on outside in the rest of the house. And if I paid attention to everything, I would be psychologically paralyzed. So the brain is always trying to save two things, time and cognitive energy. And so it latches on to stereotypes and biases because they provide the perfect shortcut to streamline this whirlwind of information so that I don't have to pause and sit down and get to know Jared. I can just say he's probably like other Jewish people I know and then move on. So the brain really wants to do this because it works really well with objects, by the way. So let's say, for example, that I've never seen this particular stimulus in my entire life, this cup. I don't have to sniff it and weigh it and get to know it intimately to understand how it works because it probably works like other cups that I've seen in the past. So I know exactly what to do with it. But people are different, right? Like we can't just say, oh, Jared, is a Jewish person. They must be like other Jewish people that I know and then move on. No, people are different. And so they require us to sit down and get to know them, but our brain doesn't want to do it because it's bombarded. So it's unfortunate because when it comes to people, they deserve our attention and that pause.
So you now know that A and B are actually the same color. Carmel has shown it to you by taking away parts of the slide. She's explained the science behind it. She's explained how the optical illusion works. So consciously, we all know that A and B are the same color. Do we see them that way? Raise your hand if you see A and B, if they still look different to you. Yeah, I'm seeing a number of hands go up. So even though consciously we know that A and B are the same color, our unconscious mind is still tricking us into thinking that they're different colors. And that's how stereotypes and biases can work as well. We can know that something is a stereotype. We can know that it's misinformation. And yet our unconscious mind can still hold on to it and cause it to leak out into our behavior in ways that can be have very small impacts or very big impacts. So for example, I mentioned I grew up in the 70s and 80s. I watched a lot of TV, saw a lot of movies. One of the images that I was bombarded with was the image of Black people, especially Black men, engaging in crime. Black men as drug dealers, as gang members, as criminals. This was something that I saw over and over again growing up. I also saw that image on the nightly news. My dad, we lived in Baltimore, and my dad loved to watch the news every night, and I'd sit and watch it next to him, and I'd see again Black men being taken away in handcuffs night after night after night, kind of programming with this idea that Black men are dangerous. I heard that from the jokes that I was told as well in my family. And I also got it in very subtle ways. And so I can remember as a little kid living in our white Jewish suburb of Baltimore and going to the mall to go shopping or go to the movies on the other side of town, on the Black side of town. And I can remember my little sister and I being in the back seat of our four-door car and my parents driving us to the mall. And every time we hit a particular intersection that marked the boundary between our side of town and the Black side of town, we would hear click as four doors would lock simultaneously every single time. My parents never said a word. In fact, consciously, my parents taught me that I should respect all people and that it doesn't matter if you're Black or white or red or green or purple, that we should respect everyone. And yet every time we drove from our white community to this Black community, we would hear click as four doors locking told us we were no longer safe. Now, as I got older, I started to understand where that stereotype came from. I started to understand that it wasn't true. As I got into college, now living in St. Louis, Missouri, I got very passionate about issues of racial justice and equity. And as I graduated college, I took a job teaching about these issues. I was conducting workshops in the community on racism and racial bias, and I would drive from school to school to teach students and teachers about these issues. And one day, I'm now about probably 23, 24 years old, and in the morning, I'm teaching a workshop at a school, an elementary school in South St. Louis. South St. Louis is predominantly white. And as I leave that school to go on to my next workshop, I drive over to North St. Louis, which is predominantly Black. And I'm sitting at a red light at the intersection between North and South St. Louis. And I catch myself lock my car door. My hand just kind of goes there. I don't consciously think about it, but I noticed that my hand just kind of went and locked the door. Now, again, consciously, I knew that I was in no more danger crossing into North St. Louis than I was in South. I knew the crime statistics in the area because I was teaching people about those racial biases. Consciously, I knew that Black people being more dangerous was just a stereotype. Consciously, I was passionate about racial equity and I was teaching others about it. But unconsciously, my mind was clinging to that old stereotype and causing me to act the same way my parents did when they locked the car doors. So our unconscious mind can hold on to stereotypes even after we know that they're no longer true, just in the same way that our unconscious mind is still causing us to look at A and B and see them as two different colors, even when we know that they're the same. And that's why it's so important to not just focus on people who hate other people consciously, but to also focus on our own unconscious and implicit biases that may still be lingering from our own socialization process.
Okay, so now we're going to do another activity. So this is called the blind spot activity. So how many people know that we have a blind spot in each eye? Okay, several people. Can anyone tell me why we have that blind spot? So it's actually where the optic nerve exits the retina to take visual information to the brain. So we don't have any photoreceptors there, so it's a blind spot. But we don't walk around seeing our blind spot. So I'm actually going to help you find your blind spots. So you're going to get interactive with your screen. So if you have a laptop or a tablet, you can bring the screen closer and farther away from your face. If you have a desktop like me, you can just move your head closer and farther away from the screen. So what I'd like you to do in this activity is to stare at the star in the center of the screen the entire time. So don't take your eyes off the star throughout the entire activity. And don't look down at it or look up at it. Try to be eye level with the star, even if you have to slouch a little bit. Okay, so now I'd like you to, make sure that you're pretty far away from your screen, like more than arm's length, like this. And now I want you to close your right eye and cover your right eye with your right hand so you really can't see out of it. And very, very slowly, so this won't work unless you do it slowly. Stare at the star and bring your face slowly closer to the screen, and at some point the left dot should disappear. Okay, so how many people found your blind spot? Okay, several, good. All right, now I'll help you find your other one. So same thing, but with your left eye. So now close your left eye, cover your left eye with your left hand, stare at the star, and very slowly bring your face closer to the screen, and at some point the right dot should disappear. Okay, good. I know it. I thought it was interesting too. So how many people found both their blind spots? Okay, several people. So that actually was not the point of the activity. The point of the activity is this. Did it just disappear or was it replaced by something else? Okay, so people are saying replaced in the chat box. What was it replaced by? Yeah, the grid lines. So here's a little secret though. The grid lines are not actually there. Your brain automatically filled in a gap of information with whatever made sense from the environment. In this case, the grid lines. Stereotypes and biases work in exactly the same way. When you have a gap of information about someone, your brain will automatically fill in that gap of information with whatever makes sense from its environment. In this case, stereotypes and biases. So it's important to recognize that our brain does this automatically, even without us realizing it. So I'm going to talk a little bit about, why this even happens. And to understand this, we have to get into the brain. So I'm first going to talk about the hardware of the brain, and then I'll turn to the software. So some evolutionary psychologists think that in a very early evolutionary time, humans needed to look at some other human and quickly determine if they were friend or foe, because sometimes our lives depended on it. So if we were to look at someone and they look similar to us, chances are they're from our same tribe and less likely to hurt us. But if we look at someone and they look different from us, chances are they're from a different tribe and more likely to hurt us. So even in this very early evolutionary time, we were associating look like me safe, not look like me dangerous. But even when they do neuroscience studies today, they find a very interesting pattern. So when I think about myself, Carmel, or when you think about yourself, when anyone thinks about themselves, they use a very specific part of the brain called the ventral portion of the medial prefrontal cortex. So it's right behind the forehead. When I meet someone who is similar to me, so let's not even say look like me, but politically similar, I will use the same part of my brain to do the thinking about them that I use to do the thinking about myself. But what do you think happens when I meet someone who is politically dissimilar from me? Do you think I use the same part of the brain? No, that's exactly right. So we actually relegate them to a more dorsal part of the medial prefrontal cortex. So we're even using different parts of real estate of the brain to do the thinking about similar versus dissimilar others, which probably influences how we treat them. So this was, mind blowing for neuroscientists when they found that out, because, they used to think, okay, the brain is only this big, 3 pounds. So there must just be one section for thinking about all humans, and one section for thinking about objects, and one section for thinking about animals. But they realize there's actually different sections to think about similar versus dissimilar others. Now, this isn't just, stranger danger, absolutely. So this isn't just about the brain. This also happens in the body. So they did this really interesting study in Italy, where they showed people a video of a hand in pain. So like into which a doctor's syringe was going. And when we see other humans in pain, it activates fight or flight. We find that very aversive, and it activates fight or flight. And one of the things that happens in fight or flight is we produce a little more sweat on our skin. And as scientists, we can measure that. So the idea is it shouldn't matter the race of the hand in pain, right? Like I should produce the same amount of sweat. If I love all people equally, I should produce the same amount of sweat, whether it's a white hand, a black hand, or even as a control for familiarity, they have this weird violet alien hand in pain. But that's not what happened. White participants produced the most sweat to the white hand in pain, followed by the weird violet alien hand, and very last, the black hand. Black participants produced the most sweat to the black hand in pain, followed by the weird violet alien hand, and very last, the white hand. So if we are not even physiologically moved enough to feel the pain of another person, this has implications for empathy and whether we're moved to help them. And the important part is that our bodies do this physiologically, automatically, and we are not aware. So what's in the hand? It's like a doctor's syringe. So something is going into it that is presumably painful. And then also I realized, Conover, you were saying if I print this out, there is no grid lines. If there should be grid lines all around, but not where the dots are. They're just supposed to be dots. So there shouldn't be any grid lines behind the dots. So any grid lines that you see is your brain automatically inserting it. Okay, so that's the hardware of the brain. Now let's talk about the software. Mahzarin Banaji and Tony Greenwald were some of the first psychologists to start popularizing the idea of implicit bias. And they coined this term mind bugs, which are like glitches in the mind that serve to perpetuate biases. So the first one you've probably heard of already is confirmation bias. So this is the idea that contrary to what we believe about ourselves, we don't go out into the world objectively taking in information. In fact, we selectively attend to information that already confirms our stereotypes and expectations that we hold. And what do we do with information that contradicts it? Ignore, disregard, distort, exceptionalize. So if you think about it, it's really a miracle that anyone changes their mind about anything ever. Because we're always looking for information that already supports what we believe. And this is the idea behind these echo chambers that people have on social media, because they already surround themselves with people they know are going to agree with them. They don't become friends with people that don't, or it's rare. We even make our friend circles so that we surround ourselves with people who are likely to agree with us or who are already similar to us. So we get even more feedback that, that we're right. The problem is that we don't believe we're doing this, right? Like we think we're being completely objective. And so therefore, This is what they call the bias blind spot, that we think everyone else can be biased, but not me. I'm more objective. So this leads to the next mind bug, which we call naive realism. And this is the idea that because we think we're objective and we're right, anybody else who comes along and gives their perspective, if it's different, we think they're just wrong and sometimes immoral. So this is why politics is so hard, for example, because it's based in these deep-seated values. And so when someone comes along and disagrees with you, you think they're wrong and immoral and terrible people. But of course, we have to realize we're all subjective. And just because somebody's perspective doesn't align with our own doesn't necessarily make it wrong. Ours is just one perspective. And finally is the fundamental attribution error. So this is an error that's common in several cultures, including our own, that whenever anyone does something, it's because of their character or their personality, something internal to them, rather than the situation they happen to be in. So for example, I'm a professor, and if a student aces my exam, I think, oh, they must be smart. And if they fail my exam, I think, oh, they must not be smart. But I don't take into account any of the situational factors, like did I actually cover this material before they were examined on it? Did I, are they dealing with other things? Is there something big going on in the world or at school, like a pandemic, that could be leading for them to underperform? And even though we may know about these situational factors, we don't intentionally take them into account because it's just easier for our brains to blame the person. So I'm not going into work right now, I'm working remotely, but when I was going in, I was a commuter. And anytime anyone would cut me off in traffic, the first thing I would think is, what an idiot, or what a jerk. And if I had just taken the time to pay attention to the entire situation, I might have realized that somebody cut him off and he had to cut me off in order to avoid an accident. Would that change how I viewed him? Absolutely. But we oftentimes don't stop to take the time or energy to take the entire situation into account when it comes to other people. We do it pretty well with ourselves, but not when it comes to other people, even though those situational factors could explain the behavior better, actually.
Okay, so we're going to do another activity, and this one again, we're going to ask for your participation. So I know most of you don't have your cameras on. If you're able to put it on for the next 10 minutes or so, this activity is a lot easier if we can see you. And we'll also ask you to go ahead and take your microphones off of mute. And unless you're in a very, very loud place, because this is going to be a verbal participation. So what I'm going to do is put a list of words on the screen. And as each word comes up on the screen, I just want you to read it out loud, loud enough for your microphone to pick it up. So again, if you can take your microphone, turn your microphone on, that'd be great. And just read each word out loud as it appears on the screen. The last word on the list is going to be a partial word. You'll just see the first 3 letters. And I just want you to complete the word out loud. So whatever word first pops into your mind, to make that a complete word, just say that word out loud. And then after you complete that last word, type that word that you said into the chat box, just so we can get a sense of what is coming up for people, since everyone's going to be saying it at roughly the same time. Okay, so again, real quick, as each word appears on the screen, read it out loud. The last word will be partial. Complete it with a full word, the first one that comes to your mind, and then type what you said into the chat box. Here we go.
Insect.
Insect.
Balloon.
Balloon.
Shoe.
Shoe.
Battery.
Terrace.
Terrible.
Yeah, I heard terrace, I heard terrible. What else did people say? Those of you who are still on mute, what came up for you?
Harry.
Type it in the chat box.
Harry.
Harry. So if everyone can just type what word they said into the chat box, that'd be great. Even if you think I already heard it. Terminal, just want to see the full range. Terry, terrace, terrible, terror, terminal. Okay. All right, Terry. Trick, somebody said. All right, that's okay. Sometimes our brains go somewhere where we can't necessarily control. Teriyaki. That's a new one. I think all the times I've done this, I've never seen that one. Excellent. Terry. All right. So we're going to do it again. And it's the same exact rules, same exact directions. As each word appears on the screen, one at a time, just read them out loud, nice and loud. The last word is going to be a partial word. And I just want you to say the first thing that comes to your mind that would make that into a whole word. And then on that last one, immediately after you say it out loud, please go ahead and type it into the chat box, even if you think we heard it. So here we go. Next list. Oh, it's not working. Hold on. There we go.
Dog.
Dog. Scottish.
Jack.
Russell.
Terrier.
Terry.
All right. So I'm seeing terrier. What else? I heard a lot of terriers. Terrier, laugh out loud. Terrier. So talk to me a little bit. What did you hear that was different in this round, and why was it different in this round?
Words were all related to one another.
Okay, words were all related to one another, and as a result, what happened?
Choose up your mind.
Okay, you kind of choose up your mind. All right.
I'm pretty sure I've never said the words insect, balloon, shoe, battery in a row before, but I know I've said Jack Russell Terrier before.
Okay. Yeah, this is a common series of words. It's a set of words that are associated with each other that kind of roll off the tongue because we've said them before. It's an association that most people are familiar with. And as a result, most people went to the same place, to terrier, in that second list. And Brian, as you said, the first set of words, there's really no connection between them. There's no relation between them. They're just a set of random words. So they don't lead your brain to any association, especially not an association that you hold in common with a lot of other people. All right, we're going to do this one more time. Same instructions. Again, turn your microphones on if you can. As each word appears on the screen, read it out loud. The last word will be a partial word. Say the very first thing that comes to your mind that completes that word, and then type it into the chat box. Here we go.
Faith.
Muhammad. Islamic.
Terrorist.
Terrorism.
Teriyaki.
Teriyaki again. After a little bit of a pause. Terrorist. Okay, so I'm seeing in the chat box terror and terrorist coming up, and I heard that from some people, and I also saw some smiles. So talk to me about what happened this time. Okay, a lot more terrorists coming up right now in the chat box, but tell me what happened this time.
This time, all of the words are all related to, I guess, religion and a certain group.
Okay.
Well, and fit in with all the news that we've been fed for the last, 20 years.
Yeah, so all these words kind of connect to an association that's been built for us over the last 20 years or so, a connection between Arab and Islamic and terrorist. And so our brains kind of went to that place, or at least for most people, not everyone, but I'm seeing a lot of terrorist or terror in the chat box. So,
and I tried to not go there. I tried hard not to go there to try. I knew the word was coming, and I tried to block it, but it still formed in my mind. So that's why I laughed, because I was consciously trying to not think of another word, and it just came.
Thank you, Nicole. And I think that's, oh, go ahead, Brian.
Yeah, I felt the same way, that it betrayed my own sensitivity around, how I mean, I felt like my own brain was betraying me because I saw it coming too.
Yeah, and I think both of you have really captured implicit bias so beautifully in what you both said. Nicole, you said consciously your mind was going, I know where this is going. I don't want to go there. I want to come up with another word. And even though we had just heard about 12 other TER words, your brain still went to this word of terrorist. And Brian, like you said, in a way, your brain betrayed your sensibilities. It betrayed your true feelings. It betrayed the kind of person that, it sounds like that you are. And that's what implicit bias is about. It's about recognizing that our brain holds on to these associations that we've been programmed with, that we hear these associations from the time, as we're growing up. Sometimes they get even more time sensitive in terms of, I think Dean said over the last 20 years, this association between Arab and Islamic and terrorist has been out there so often. We heard it after 9/11, but we continue to hear it in political discourse. We see it in movies and TV shows in which terrorists are always depicted as Islamic, as Arab. If you're anything like me, when you get together with your family for big family celebrations and people start talking about politics, this association gets brought up then. It's so present in our society that our brains absorb it, even if we know better, even if we know it's not true, even if we don't want to absorb it, our brains tend to absorb it. And then when it's triggered, our brains kind of recall it. Our brains go there when it's triggered. And so I'm seeing, in the chat box, could have more to do with training received, at least from an EMS perspective. Does someone want to say a little bit more about that? Training and witnessed. Okay.
Well, training, we've been trained in EMS and law enforcement and the fire department to recognize things that we've never thought of about terrorism, not only over the last 20 years, but I would venture to say since 1981, really. So it's not so much biased unless it's a learned bias, but it was part of our training.
Okay. Yeah, and so thank you for bringing that in, because that even I think starts to show how sometimes some of these biases can actually get formalized as well. Because if you look at FBI statistics, if you look at hate crime statistics over the last 30, 40 years, the vast majority of acts of domestic terrorism have actually been committed by white men, not by Arab Americans, not by Arabs.
So you still consider it a bias?
So yeah, what I'd say is the reason I would consider it a bias is because it's actually not true. If the goal of training is to cue us into where terrorism is most likely to come from, it's not typically coming from Arabs or Muslim Americans or Muslims or Arabs in general.
So could there be a bias in you're taught to not allow somebody to get within 6 feet of you for safety reasons, or if they have a weapon, or could that be a bias, or is that just life-saving training?
Yeah, what I'd say is the message that I'm learning based in fact and data, or is it based on a perception and a stereotype? To me, that's where the difference is. And it's what is this information based on? Is it sound information, or is the information actually undermining what the reality is? And we'll talk a little bit more about that in just a bit, actually, and we'll actually bring in some statistics and things like that to show how sometimes both our societal programming, but also sometimes our training can actually steer us in the wrong direction. So definitely we'll come back to that.
So you're still saying it's a bias rather than training, because it's safety oriented training. If a person has an edged weapon and they're within 13 feet of you, and you have a weapon that happens to be a gun, don't bring a knife fight to a gunfight. So.
Yeah, what I'd say is that, again, is it based on data or not? So if someone has a weapon and they're approaching me, I think that's not necessarily a bias, that there's some data that I may really be in danger. If it's about the color of the person's skin or what I perceive their faith to be, that's where I'd say it's different, because the data that I have there's no data to suggest I'm really in danger in that situation. Having a weapon
really doesn't matter what color they are. If they've got a weapon and they don't drop it,
right,
they're going to be dropped.
Absolutely. And that's what I'm saying, like that weapon is your data, that the danger may be real as opposed to a perceived danger, if that makes sense.
Plus you add your training to that too, because most people don't know that you don't have the reaction time within 13 feet of somebody with an edged weapon.
Sure. Okay. So, I guess part of what we're getting at is kind of what is it that's triggering us? Is it some real data, and I'm sorry, Fire Hockey, I don't know your actual name, but is it some real data, like a weapon that is with somebody coming close to us that's signaling us that danger is imminent, Or are we basing our reaction, is our reaction based on a stereotype, on misinformation? And the reality, I think, is that if my brain can be triggered to go to this place from a list of words on a screen, when else could it be triggered? Could it be triggered when I'm sitting on an airplane and someone I perceive to be Arab or Muslim comes down the aisle? Could it be triggered when I'm have a student who's Arab or Muslim, or I perceive to be Arab or Muslim? And could it cause me to treat them in a way that, again, betrays how I want to treat them? And if the association around Arab and Islamic and terrorism is there in my brain, what other associations could be in there around race and ethnicity, gender, sexual orientation, ability, accents, immigration status, and so on? And when might those be triggered? And how might that, and if it goes off in my brain, could it impact my behavior in some way? And so, Carmel, I want to invite you in because you've got a particular story around this.
Yeah, so my parents were born and raised in Egypt, and they immigrated here before I was born. And it's a Muslim country, and I've been back there many times, and I have lots of Muslim friends there and Muslim friends here. Yet when I first did this activity, the first thing that came to mind was terrorist. And I'm like, oh, you got to be kidding me. Like, I've been doing this work for many years. My family is Middle Eastern. Like, why am I having this association? And it's because I was exposed to the same negative messages about my group, growing up, or Muslims growing up, that we all were, especially post 9/11, like you were mentioning. And so, you'll be surprised. Every time we do this activity, we get the same response. People will be like, terrier. And then the next one comes up and they're like, ooh. And they feel ashamed and embarrassed and they don't want to say it out loud. And I would actually say, a lot of people just kind of try to push it out of their minds and act like it didn't happen and move on. And I would say do the opposite. It's
So
actually.
can I interrupt with just another question?
Sure.
So if you're in kindergarten through grade school and then through middle school and through high school, if you're taught how to form a sentence and you're basically printing a sentence outside of the first example, the second example, the third example, it's a might not be as much of a bias as it is a learned how to formulate a sentence.
Well, yeah, I mean, I agree with you in that, information that is correct can be learned and biases can be learned too. So I wouldn't say that, that just because something is learned that it's a bias versus correct information. It depends on the type of information and whether it has, like Jared said, it's been rooted in sound information, like, this is how we formulate a sentence. Great. This is how we're going to formulate a sentence in the future. So we're not saying everything that's learned is a bias. I think what I'm saying is, like Jared was saying, if we look at the data, right, there's certainly acts of Islamic terrorism, but there's a lot of acts of terrorism from other people. So in fact, if you look at over the past several years, most of the domestic terrorism is perpetrated by white men. And, the idea is not to replace one stereotype with another. It's about actively dismantling stereotypes and replacing it with more sound information. So it's kind of like what I was saying earlier in terms of, stereotypes fill in gaps of information for us. And if the stereotype is true, then that's not a problem, right? Like if we can say that it applies to all people all of the time, or even a vast majority of the time, then it's probably a good rule of thumb to rely on. So, if I learn that cups that look like this, I drink from, then it's no problem to apply that stereotype to a new cup that I've never encountered before, because that's sound information. If it's about how to form a sentence, that's no problem because it's sound information. But if we look at the data and there's something that's not sound, then that can become a potential problem in terms of relying on a stereotype. So I think, most people, when they rely on a stereotype that they at least have an inkling isn't based on sound information, their initial response is to act like it never happened or ignore it or push it away. And what we're saying is actually do the opposite. Reflect on it and where it came from. Well, actually, first we have to pause enough to detect that you've relied on a stereotype. So in this activity, it was easy because it's in front of us. We have enough time and space, and it was I could feel the term terrorist pop up for me. But in the real world, like I said, we're bombarded with lots of information. We don't always have that opportunity. So the idea becomes, can we slow down enough to detect that we've relied on a stereotype? The next step is to reflect on where it came from. So instead of pushing it away, we can say, okay, where did I learn this, Carmel? Did I learn this from media images that were plastered all over the media that may exaggerate the prevalence of this occurrence? Can I look into the statistics and data to see if it's actually true that most Muslims are terrorists, or a vast majority of Muslims are terrorists? And if I don't believe it, if I find it to not be true, how can I actively reject it by replacing it with a non-stereotypic thought? So how can I dismantle this idea so that the habit is not relying on the stereotype, but replacing it with a new habit to replace it with a non-stereotypic thought? And so we really have to get away from this good person, bad person paradigm, right? Just because we may have absorbed these stereotypic associations from society doesn't make us a bad person. I don't think I'm a bad person. At least I try to be a good person. But I may still have absorbed these stereotypes from society. And so, again, just because you may have implicit biases doesn't necessarily make you a bad person. It just means, congratulations, you successfully absorbed these messages that society has given to you. But, even when I take these implicit bias tests, like you may have heard of these national data sets like Project Implicit at the Harvard website. Even when I take those bias tests, it shows that I have an implicit preference for whites over blacks, an implicit preference for whites over Latinx folks, an implicit preference for whites over Asian Americans, and an implicit preference for whites over Middle Easterners over my own group. Do I want that association? No. Can I change the stereotypic messages that I started absorbing at age 3? No. But at least I'm aware, because I am not empowered to stop biases from leaking out into my behavior until I'm aware of what they are and how they impact my behavior. So that's what this workshop is about, is really about enhancing awareness of what stereotypes and biases are, and then practicing the strategy so that we can disrupt the impact that they may have on our behavior.
All right. So before the break, we went through this kind of terrorist activity, and we started talking about how, many of us, when we got to terrier, there was kind of this excitement. And for those who, when we got to terrorist, there was kind of this sense of ooh, and not liking that. And we want to kind of reemphasize again that this is not about feeling guilty or ashamed or embarrassed. It's just about recognizing what kind of programming have we had, and when is that programming serving us versus when is that programming undermining our best efforts and our best intentions. And part of the reason we say it's not something we have to feel guilty about is because we didn't ask for this programming. The parallel that we'd use is that of living in a polluted world. If I grew up in a house that's situated right by these smokestacks that are putting out pollution into the air every day, as I go about my life and as I go about breathing, which I need to do to survive, I take in the air around me. I breathe that air in, it goes through my system, I breathe out. But some of the pollution that's in the air comes into my system when I breathe it in. And not all of that pollution is exhaled when I breathe out. So some of that pollution gets and lingers in my lungs, in my bloodstream, and it can cause some serious health problems for me. So if I go to the doctor and the doctor tells me, yeah, these symptoms that you're having, it's because you've been exposed to too much pollution, air pollution, and it's affecting your system. Typically, I don't feel guilty or ashamed about that. I don't think I'm a bad person for having absorbed the air pollution in the air around me. And I'd say the same is true around stereotypes. The stereotypes are basically a form of social pollution. They're out there in the air around us, in the media and in politics and in conversations we overhear and in school and other places. And our brain is doing exactly what our brain is designed to do. It takes in information from the world around us. It stores that information, it organizes it, and then it recalls it when prompted. So it's not that we're bad people. It's not that we've done anything wrong. Our brains are doing what they're designed to do. The problem is that some of the information that our brains take in is good information, and some of the information our brains take in is bad information. And our unconscious doesn't necessarily know the difference. It just takes it all in as data. And so the question is, what can we do about this bad data, this misinformation, these stereotypes that our brain has absorbed and that may linger there inside of us? So as Carmel said, what we have to learn to do is, one, be aware of it, two, to notice when it's happening, and then three, to be able to reflect on it and stop it from impacting our behavior. So one of the steps of that is to recognize where this comes from. And so what we want to do is explore some examples of social pollution, of stereotypes that are out there in the world around us. So the first piece we're going to look at is these two children's book covers. We've got How to Be Gorgeous and How to Be Clever. As you look at these children's book covers, what messages are they sending to us about what it means to be a girl versus what it means to be a boy, about what girls should care about versus what boys should care about, and what we should value in girls versus what we should value in boys? I'd love to hear your thoughts. You can take yourself off of mute and share, or you can share in the chat box. What do you see in these two book covers? Boys are what and girls are what? Okay, so someone says, I see banned books. Actually, these books are available to you on Amazon. They were published in 2012. Okay, so the girls should care about their looks and boys should value in education. So yeah, that's one of the messages here, is that girls should focus on looks, being attractive, physically attractive. Boys should focus on their smarts, on their education. We're also seeing different images. So the girl is kind of, in a very, she's not taking up much space. She's kind of lying down on her bed, over the pillow. The boy is taking up a lot of space. His arms are outstretched. He's winning. He's at some kind of a podium with a buzzer on it. He's in a contest and winning. And so we start to see that we start to train kids at an early age to go in certain directions. If you're a girl, focus on your looks, care about your looks. You're going to be valued based on your looks. The way to get ahead is based on your looks. If you're a boy, focus on your brain. You can be smart. You should be smart. Yeah, so Jay Schultz says, girls are supposed to be pretty, boys are supposed to be smart. We're also seeing that gender is presented very much as a binary, that there's girls and there are boys, and that's all there is. And girls should focus on looks and boys should focus on smarts. And these messages continue even when we're past children's books. So now we have two Sports Illustrated covers, both featuring world-class tennis players. And again, what's the message about gender here? What's the message about men versus women? What men are valued for and featured for, and what women are valued for and featured for? What do you see? Again, you can share in the chat box or share verbally. Take yourself off, put your microphone on and share verbally.
It's just interesting that the woman, that the female in the Sports Illustrated is not being honored for her athleticism, which is seemingly why she would be a part of Sports Illustrated and as a top tennis player, but instead for her looks and she's not even dressed as an athlete in that picture.
Yeah, and someone else, Alexa, said, I didn't even realize the one on the right was related to sports until I mentioned it. So she's not being featured for her talent, her skill, the fact that she was the #8 tennis player in the world at one point. She's being featured simply based on her looks, whereas he's being featured as a master, as the best ever, as he's being shown to be doing what he's good at. He's being shown in an active position, and she's in a passive position. And so on. And so these types of messages that we're exposed to over and over and over again, think about the number of these messages that we see over a lifetime, start to train our minds into certain expectations of people based on gender. But it also happens to be around race. So these two images are from newspaper clippings taken after Hurricane Katrina in 2005 in New Orleans. The top one, we see an image of a Black person in the floodwaters with a bag. The bottom one, two white people with bags in floodwater. But the text at the top says a young man walks through chest-deep floodwater after looting a grocery store. And the bottom text says two residents wade through chest-deep water after finding bread and soda from a local grocery store. So if I don't know anything about these individuals, and this is what I'm reading and seeing, what messages am I taking away about who Black people are versus who white people are? What's the message that's being communicated?
Lucky versus thieves.
Okay, so he's a thief, the Black person's a thief. They're just lucky, they're survivors. They're doing their best in this horrible situation. They're resourceful, maybe even. And so, you've got this sense of criminality versus innocence. You've also got a sense based on the words, he's a young man, they're residents. In other words, they're part of our community, they belong. They're just like us. And these messages go back a long time. They're not new. These newspaper clippings are only two examples of, literally thousands of examples we could pull up. And we could go back in time as well. So these are a series of soap ads that appeared in US magazines and newspapers between 1827 and 1921, almost 100 years worth of ads. And what do you see? What messages are being sent by these ads about what it means to be Black versus what it means to be white?
Being a person of color means that you're dirty. That's the message that's coming across in all of those ads.
Okay. Yeah, there's an association between being a person of color, being Black, and being dirty, and whiteness is associated with cleanliness. Whiteness is also associated with, goodness, because it's better to be clean than to be dirty. Otherwise, why use this soap? Because this soap will help you get from Black to white, from dirty to clean. Now, that's 1827 to 1921. This is 2017, just 4 years ago. Two more soap ads. The one on the left was a TV ad in which this Black woman with a tan shirt uses Dove soap, lifts up her shirt to reveal a nice, clean white shirt underneath, but also a woman with white skin. The ad on the right was a print ad, and we have the words before and after at the top of the screen, before using Dove soap and after using Dove soap. And look at who's under before, and look at who's under after. And what messages are these two ads sending to us? It's the same message as we saw in 1827 and the early 1900s. We have an association again between Blackness and dirty and whiteness and clean. And I see the question about, is the choice to ban it from our history or learn from the mistakes? And so I'd say, that the goal is to learn. It's not about banning it. It's about understanding that these messages have been with us for a long time and actually are still with us and maybe having an impact on us unconsciously, which means that we may be having an impact on other people accordingly. If I've learned to see Blackness as bad and dirty and whiteness as good and clean and pure, that may have an impact on me unconsciously, even if I don't agree with that consciously. And it's important to note that these two ads in 2017 were pulled within weeks of appearing because there was such a public backlash to them. There was an outcry at people seeing these subtle messages. So in one sense, we have begun to learn. We've begun to say, hey, when something's messed up, we need to do something about it. On the other hand, if you think about what it takes to get an ad from concept to publication, these ads went through a lot of stages and still kind of made it through the process. We were doing this workshop a while back, and someone in one of the participants had a background in advertising and said, every ad is seen by over 200,000 sets of eyes before it gets published. So the question is, over 200,000 sets of eyes saw these ads, and did they not see anything wrong with it? Did they not see the subtle messages that were being portrayed? And if so, why not? Or maybe did someone see it, but just feel like they couldn't speak up because they were too afraid, maybe for their job or for the reaction? Or maybe someone did speak up and they were dismissed as being too sensitive. But either way, regardless of how it happened, these messages one, these ads kind of show that these messages are still with us. And two, every time we see them, it can reinforce the message unless we stop, take note, and kind of deconstruct them and really kind of challenge them. And these messages are with us in a variety of ways. So on the left, we see the results of a study that was done just a couple of years ago, looking at how Latinos are depicted in US media. And they found that of all of the different types of images and messages about Latinos in US media, 36% of all the times Latinos were portrayed in media, they were portrayed as criminals, 31% of gardeners, and 31% as maids. And it's not to say there's anything wrong with being a gardener or a maid and that there aren't very real reasons why people do turn to crime. But if 98% of the images about a whole group of people put them in one of only 3 roles, what does that mean for how we start to see those people? What does it mean for how those people start to see themselves? You know, what does it mean for the Latina or Latino little kid who's growing up, and what opportunities they may see as available to them, what roles they may aspire to, what dreams they may allow themselves to have? What does it mean for the teacher who teaches those students about the expectations that they may have for them, or the kinds of opportunities they may recommend them for, or encourage them for, or not encourage them for? You know, I see Dean said in the chat box, going back to the previous ads, about 200,000 sets of eyes with the same perspective. And we can start to see how our perspective starts to be shaped by the world around us, influencing what we see and don't see, what we notice and don't notice. And if you think about how these images of, I'm sorry, I thought I said, was it?
Is it okay if I jump in too, just
Absolutely.
to, because I think, Dean, maybe am I interpreting, because when I saw that comment that you made, the thing that struck me was, oh, part of the problem was the 200 eyes. It is coming back to the fact that if you don't have diversity within the group of people that were reviewing that, or that were developing it and getting it ready for print, that's the problem, is that because you had a lack of diverse thought or perspective in looking at that, is how you end up with an ad like that those companies then have to turn around and take down because it's an obvious mistake.
Yeah, thank you, Brian, for making that explicit. Yeah, you know, if there's not the diversity in the room, if there's only that limited perspective, then certain things are going to be missed. Or if there may be diversity in the room, but if it's not safe enough for people to speak up, then the diversity in the room may not matter because the perspective may never be allowed to be expressed. And, you know, we'll talk about how that relates to medicine in a bit. Going back to the images on the screen, you know, we can compare, you know, what's the impact of messages about Latinos compared to messages about Asian Americans in our society, and who are often depicted as smart and good at math and good at science, which in some ways sets up a whole different set of expectations for Asian students than it does for Latinx students, but is equally limiting in many ways as well. And quote unquote positive stereotypes can be just as damaging as stereotypes that are considered negative. We can even see during a pandemic how stereotyping starts to play out. You know, we heard over the last year, COVID-19 being referred to as Kung flu, this association between the pandemic and very stereotypical Asian connotations. And as a result, what we see is translations into people's behavior, where 32% of Americans witnessed Asians being blamed for the pandemic, 60% of Asians witnessed that. And if we look at FBI statistics around hate crimes and hate incidences, we can see an explosion in harassment of and hate crimes against Asian Americans in the last year alone. I think the last statistic I saw was over 900% increase in violence against and harassment against Asian Americans in our society in the last year. So we can see that the ways in which we frame things shape how we feel and how we act and how we think.
All right, so I just wanted to kind of, you know, highlight how, you know, up until this point, we were talking about how stereotypes really oversimplify a complex world, and that's why our brains are attracted to them. But they do oversimplify, right? So stereotypes are these cognitive associations that we have that, you know, help us to streamline information because we're being bombarded with information all the time. So that's why our brains are attracted to it. And we should realize that, you know, we learn these stereotypes even before we have values attached to certain groups. So even before we learn that group A is good and group B is bad, we've already learned that group A is like this and group B is like that. And we like this and we don't like that. So then it's no surprise that, you know, given that our brains are set up this way and given all the input that we've received through the media, like Jared just went through, that a lot of these implicit biases are prevalent. So research shows that 70, some even say up to 75% of all Americans have an implicit preference for whites over blacks, but 40% of Black Americans have an implicit preference for whites over blacks too, over their own group. And that's because they were exposed to the same negative messages that we all were growing up in this society. So just because you're from that group doesn't necessarily make you immune to the biases about it. And so that's what we mean when we talk about internalized bias. That's one of the reasons that, you know, that I have an implicit preference for whites over Middle Easterners over my own group. Again, do I want that association? No. Can I change the messages that I received growing up in this society that painted my group in a negative light, especially post 9/11? No, but at least I'm aware, because again, I'm not empowered to stop it from impacting my behavior until I first know what my biases are. 61% of test takers, so this is all from the Project Implicit National Database, which has over 18 million completed tests to date. So they show that 61% of test takers associated white with American and Asian with foreign. So like Jared said, even though Asian Americans are often cast in this model minority light that, you know, because they have higher academic achievement, higher incomes, lower incarceration rates, lower divorce rates, that they're this model minority, they're still perceived as the perpetual foreigner. And 57% of people, of test takers, associated white with American and Native American with foreign. So people are associating white with American even more than the original Americans. It's not just about race and ethnicity. So 76% of people implicitly associate males with career and female with family. 69%, actually some people say even closer to 80% now, of people implicitly prefer thin to overweight people. And 72% of people implicitly associate males with science and females with humanities, which is important for someone like me, right? I'm a professor and I want my female students to succeed in the sciences just like I want my male students to succeed. So if I know that I may have a bias like this, then I can do certain things to structure my environment to stop my biases from impacting my judgments and decisions. For example, I like blind procedures when you can. So I do blind grading where I have my students write their names on the face page of the exam, excuse me, and I have them write their short essays on a different page. So that way, when I come to grade, I flip all the name pages and I can just grade blindly. So that's one way that, you know, you structure your environment in such a way. You can't always do blind procedures, but it can help a lot. 76% of people implicitly prefer people without disabilities to those with disabilities. 68% of people prefer straight to gay people. So even in today's current environment where the Supreme Court has ruled that discrimination in the workplace against LGBTQIA folks is still illegal, 2/3 of the test takers still implicitly prefer straight to gay people. And 80% of people implicitly prefer the young to the old. And this is even among elderly test takers. So again, just because you're from that group doesn't necessarily make you immune to the biases about it. Okay, so now we're going to do another interactive activity. This is the Lap Slap game, and it's designed to mimic some of these implicit bias tests that you can find at Project Implicit. So in this game, you'll see two categories, one on the left and the other on the right. You'll also see words appear on the screen which will either belong in the left or the right category. So your job is simple. When you see a word that belongs in the left category, use your left hand to slap your left thigh. When you see a word that belongs in the right category, use your right hand to slap your right thigh. Okay, so we'll start off simple. If you see a word that is an insect, so you see the word beetle or gnat or mosquito, you're going to slap your left thigh. If you see a word that is a flower, so you see daisy, rose, daffodil, you're going to slap your right thigh. Now, here's the kicker. It's going to go fast, but that's okay. Even if you make a few mistakes, the important thing is to just keep going in this game. Okay? So if you are in a relatively quiet place, go ahead and take yourself off of mute, just because it helps me to hear the lap slapping so I can tell, you know, the unison of the clapping. So left for insects, right for flowers. Ready, set, go. Okay, how was that? Pretty straightforward? Yeah, I could tell by the unison in the clap in the slapping that it was pretty straightforward. And no, Bill, this isn't to give us all black eyes. I'm making sure that you heard lap slap, not face slap. All right, so now let's do the next round. So now if you see a bad word, so something like death or evil, slap your left thigh. If you see a good word, something like love or peace, slap your right thigh. So bad on the left, good on the right. Okay, ready, set, go. Okay, straightforward again? Yeah? I kind of heard it. It was pretty straightforward.
Mostly.
Mostly. That's okay. If you make a few mistakes, it's okay. All right, so now the categories have been combined. So now if you see a bad word or an insect, slap your left thigh. If you see a good word or a flower, slap your right thigh. So if you see death or beetle, slap your left thigh. If you see love or daisy, slap your right thigh. Okay, so bad or insects on the left, good or flowers on the right. Ready, set, go. Okay, very good. I could tell it was, you know, it was combined, but I could tell pretty straightforward. All right, so now the categories have switched. So now if you see a bad word or a flower, slap your left thigh. If you see a good word or an insect, slap your right thigh. So if you see death or daisy, slap your left thigh. If you see love or beetle, slap your right thigh. Okay? All right, ready, set, go.
I can't do it.
I can't.
Wah, wah, wah.
Uh,
Wow. That.
Okay, so how was that?
Put us out of our misery.
What did you say?
That
Put
was-
me out of my misery?
Put us out of our misery.
That was
So
difficult.
That was difficult. Okay, so talk to me about what do you think made this one more difficult?
I was able, my personal distaste for insects made me align them with bad very easily before. So maybe that was my own personal connection. But having trained my brain that the two were aligned together before, and then swapping that, I wasn't able to cross-reference the word and then get to the right leg.
Right. So that's actually a really good point. Was that Dean?
Brian.
Brian. Yeah, Brian, that's a good point, because a lot of people think it's an order effect, right? So they think, okay, well, you conditioned me to do it in one way, and then you switched it up on us. So of course that second way is going to be harder. But actually that's not the case, because even when we do the first round first, or when researchers put that second round, the harder round first, it's still harder. And that's because any temporary conditioning that you do in this activity is not enough to override the societal conditioning, like you said, associating bugs with bad and flowers with good, relatively speaking, rather than the other way around. Now, truth be told, if it did come first, it would be a little easier, but not significantly so. And it certainly wouldn't reverse it so that it's now a lot easier than the other round.
Brian, correct me if I'm wrong, but I think Brian, like me, associated bugs with bad long before this class came up.
Right. Yeah, that's exactly right. So actually the logic of this test is the stronger the association is in your head, the faster and easier it'll be for you to respond. So it's revealing the strength of the association in your head. So for most of us, including me, bugs were associated with bad and flowers with good. And that's what is being revealed here in this test. Okay. Or this activity, I should say. All right. So now we're going to do 2 more rounds. So I want people to be engaged. So now if you see a bad word or a stereotypically Black name, so Latanya or Siobhan, again, white people can have these names too. We're talking about stereotypic in our society. If you see a bad word or a stereotypically Black name, slap your left thigh. If you see a good word or a stereotypically white name like Emily or Colleen, slap your right thigh. Again, Black people can have those names too, but we're talking about stereotypical in our society. So bad or Black on the left, good or white on the right. Okay, ready, set, go. Okay, pretty straightforward. Good, I can tell. All right, so here's the last round, so give it your all. Now the categories have switched. So now if you see a bad word or a stereotypically white name, slap your left thigh. If you see a good word or a stereotypically Black name, slap your right thigh. Okay, so bad or white on the left, good or Black on the right. Okay. Ready, set, go. All right, so how did that go for you all?
I had a hard time.
In the second one again?
Yeah, just processing, to stop and think about it each time almost.
Mm-hmm. And did you have to stop and process it more for the second round than the first round?
Oh, yeah.
Yeah. Yeah, that's not uncommon. I have the same responses when I do this test, even now, even though I've been doing this for many years. So that's why I say, if you do find yourself having tendencies in this direction, it doesn't mean that you're a bad person. It just means congratulations, you're part of the 75% that absorbed the association of white with good and black with bad, relatively speaking. So again, it's showing that that association is stronger than the reverse. So then the question becomes, all right, well, this is just this, this test that is trying to go fast to get at our implicit biases, which, by the way, it needs to go fast because it is getting at unconscious biases, not conscious ones. If we gave you more time, your conscious biases would take over. Yeah, so Bill, it's very similar to the shoot, don't shoot law enforcement drill. Absolutely. It's based on the same reaction time logic. So the question becomes, how do these implicit biases actually impact our behavior? And then how can we recognize it and then do something to mitigate its impact? So now we're gonna, this entire afternoon we've been talking about, implicit bias that lives in me, and me being the perpetrator of bias. But now I want to switch gears a little bit to think about the other side. So what is it like to be the target of a stereotype or bias? And no groups are immune to stereotypes. All groups have stereotypes that apply to them. So what I'd like you to do now is just take a few seconds to think of a time when you were stereotyped. So it could be based on your race or ethnicity, on your gender, on your profession, any social identity that you have. And I'd like you to think of some of the emotions that you felt and what impact it had on you. And if you feel comfortable, go ahead and share your thoughts about that in the chat box.
Might be too much to write, just kidding.
Well, I mean, you can also verbalize it too, if you'd like.
Okay.
I mean, I'll
right now?
Yeah, sure.
So my first time ever in, I work in EMS, paramedic for a long time, worked in a predominantly male field, never felt like I wasn't strong enough or good enough, that I couldn't do the job. Although I did work with females that did struggle with that. I personally never had that experience. Always felt very respected. But when I got into upper management, I actually went to have a meeting with a political consultant, and was told in the meeting, where I was sitting next to a fire chief, my equal basically, and was told by the political consultant that I needed to fem up a little bit. And you guys can all see me on the camera. This is how I look. And I was told that I needed to put some makeup on and wear a dress so that I could be taken more seriously, because I came to the meeting in a pantsuit. And that was the first time that I like to think that I'm a pretty feminine person, but I felt ugly, horrible, not worthy. I was sitting next to a male fire chief when this was said to me. And I tried to look at it from the perspective of the person that was telling me this information. He was a lot older than me, older than my father, came from a very different background, where he was probably coming from a good place in his mind. And I really tried to put my feelings aside, but I was pissed because I felt, I worked really hard to get to where I was, and I was told that I couldn't get a meeting with another female board of supervisor because I needed to fem myself up, and literally words, put on a dress and wear some makeup. So that was hard. Probably the most difficult thing in my 20 years prior to that meeting that I had as a female in EMS was that 20-minute conversation.
Thank you very much for sharing, Nicole. First of all, I'm sorry that that happened to you. That must have been very difficult and insulting, because you worked so hard to get to where you are. And then to just say, to sort of be told you have to do this, knowing that that doesn't bear any, that has no bearing on your ability to do your job, must be really frustrating. So thank you for sharing that. And, you know, it happens all the time, unfortunately. I mean, like it could be overt, like what they were saying. And by the way, I meant to say this when I was listening to you speaking. I like how you tried to separate, like, well, maybe, you know, you're trying to take his perspective. Like, he's from a very different time and background. So maybe he was trying to come from a good place. I think that's very sophisticated and gracious. But at the same time, it really hurt and was frustrating. And so, you know, there is this, like, you know, way that we can separate ourselves and try to take their perspective, but that's not to invalidate the feelings that come along with it.
And I remember not even wanting to acknowledge it to him, right? Because I didn't want to be a chick about it. So that was another challenge that I had, that I was so pissed, and I felt something I'd never felt my entire career, but I hesitated bringing it up to my boss or even circling back to this person when I calmed down, because I didn't want to put that stereotype on myself of being a complainer, right, in this field. So I cooled off for a couple days, and I went back and had a crucial conversation with them, because that I'm comfortable doing that in every pretty much aspect of my life, except when it comes to personal things with like that, because I don't want to seem weak. But that was a good learning for me, where I called them on the carpet, and yeah, so that's all I'll say about that. But it was pretty difficult.
Yeah, so it's complex, right? You're in this you're in this male dominated field, and you're trying to not look weak, you know, to disconfirm any stereotypes that people may have about women being weaker or emotional or irrational. So when you do want to say something, and you should have said something, which I'm glad that you did, you still have to then also balance, okay, well, how am I going to say this so that I don't fulfill this other stereotype that they're expecting me to fulfill? So it's a difficult, tricky situation. And it could happen in terms of like overt, like what was said to you overtly, but it can also happen in more subtle ways. So I'll say two things. So first of all, when they advertise these implicit bias workshops, sometimes they just put Dr. Sod. And when we were doing these in person pre-COVID, I showed up to one, and a woman came up to me actually, and she said, "Oh, you're a woman," because she didn't associate doctor with being a woman, right? And I said, "Yeah." But then she said, "I guess I'm in the right place." And that to me was a really positive interaction, because it's not about not making mistakes, because we all make mistakes. I make mistakes all the time, but it's about recognizing that it's a mistake and then wanting to do better. And that's what I saw in her. Another thing though about the gender dynamic is, you know, it could happen in overt ways in a meeting, but sometimes, I don't know if you've ever been in this situation, but you know, you're in a meeting and there's men and women, and you know, a woman will say something and it'll kind of get ignored, and then a few minutes later a man will basically say a version of the same thing, and all of a sudden the wisdom of the comment is revealed. And it's frustrating because it makes you feel unheard and unseen, and you work so hard to get there, and it's like, why can't I be taken seriously too? So I'm sorry that happened, and I understand it can be frustrating. Let's talk about it from the perspective of the target. So when we talk about the impact of explicit versus implicit bias, oftentimes we'll talk about explicit bias affecting explicit behaviors and implicit bias affecting implicit behaviors. So explicit bias can affect more overt behaviors, things that we presumably sit and deliberate on, like how friendly our words are, who we vote for. But implicit bias predicts more subtle behaviors, like how rapidly we blink, whether we lean forward or back in a conversation, how much eye contact we make, how much we laugh at a joke, even how far away we sit from people. So there's this really interesting study that showed that white individuals will sit farther away from Black individuals in workplace meetings as opposed to other white individuals. And it's not by very much, it's only a few inches, but it's consistent. So imagine I'm the one sitting farther away from the Black person. I don't know that I'm doing this consciously. They don't pick up on it consciously, But after a few months, they may think, you know, there's a weird vibe here. I don't feel like I belong. And so that's what we mean by creating this environment or this climate that people can't put their finger on, but they're not, it's not hospitable to them. They don't feel comfortable. They may feel alienated or offended. By the way, if you hear screaming in my background, that's my 18-month-old coworker, so please excuse. I don't know if you can hear him or not. Sometimes when we talk about explicit versus implicit bias, we talk about macroaggressions versus microaggressions. And, you know, macroaggressions are rooted in explicit bias. So people are aware of the bias and express it directly and oftentimes endorse it. So they can say things like, you don't belong here, go back to where you came from. Obviously, people know that that's conscious attitudes that they have. But sometimes it can be more unconscious, and actually people can think that it's complimentary or an innocuous statement or just starting small talk. So, you know, I had in graduate school, my advisor was Chinese American, Stanley Su, and he would tell the story about how he'd get into a taxi cab and the cab driver would say, oh, where are you from? And he'd say, Portland, Oregon. And he'd say, no, where are you really from? And he'd say, Portland, Oregon. And he'd say, no, where are you really, really from? And eventually he realized he was asking about his heritage, where his parents were from, his nationality. But, you know, even though it was meant to be an innocuous statement, there's a lot of research, especially for microaggressions towards Asian Americans, to make them feel like the perpetual foreigner, right? It can come in all sorts of other forms, these microaggressions, like, oh, you're so articulate, or you speak so well. Or sometimes, oh, you don't speak Spanish, right? As if it's a requirement. So there's a lot of different types of microaggressions that people just don't realize. And then it creates this weird experience with, wait, should I say something? Or now am I being too sensitive? It's going to make things awkward. Should I not bring it up? And it just creates this ambiguity. So yeah, Nicole, I saw that. I was going to see if you wanted to share, but it looks like you share in the chat box. Did you want to elaborate a little bit?
Sure. I just had you know, when I promoted to director, I had someone that I replaced talk about, you know, how the balance is going, work-home balance with our family, because my husband and I have 2 young kiddos and we're both in EMS. And I said, oh yeah, it's working out great. And, you know, things are going well. And he's like, oh, that's awesome. You know, it was just more important. When I had small kids, it was just more important for my wife and I that their mother was home for them. And I was like, wait. And I was like, oh, okay. And then I was like, wait, what was that? That just, wait, did I misinterpret that? So, you know, again, I don't think he meant badly. I just think he was clueless to the comment, but
a lot
like,
of times,
wow.
Yeah, a lot of times for microaggressions, they don't mean badly. You know, for implicit bias, they don't mean badly, but it doesn't mean that the impact is any less. So Jared, did you want to talk about that a little bit?
Yeah, you know, Carmel was just saying that, you know, there's a difference between intent and impact. And the intent may be positive, the intent may be innocent, but the impact can be significant. And sometimes with the term microaggression, there's a mistaken sense that, oh, these are just really small things and people should just get over it and just kind of brush it off. It's no big deal. So micro is really about describing the intention behind the comment, or the fact that these are not kind of big, huge acts of aggression, but are these kind of more commonplace, everyday little things. It's almost like that death by 1,000 paper cuts, as opposed to, you know, the really big wound. And so, but the impact of microaggressions can be significant. They can, you know, the constant day-to-day exposure to these types of invalidations can lead to anxiety, depression, sleep problems, eating problems, low confidence, helplessness, a loss of drive, that internal dilemma that Nicole and Carmel, you were talking about before, of like, now instead of focusing on this meeting, now I'm trying to figure out what do I actually do, and that can undermine my performance, and so many other things. And so, you know, it's important to recognize that the micro is describing the intent, but the impact can still be rather significant.
Yeah, and I'll just say, I mean, women are the target of those types of comments a lot. I mean, I even got them of like, oh, you know, you're still doing, you know, the implicit bias work and you're a professor, like, that's great, you know, that do you have time for your son? Or, you know what I mean? Like, they're not trying to, like, they're just, you know, but my husband would never get that question. And actually, Jared, I'm sorry. I usually don't call on you, but I feel like you have a nice perspective from a father.
Yeah, I mean, so when my children's mother and I, we have 10-year-old twin girls, and after they were born, constantly I would be out in public and be told, people would make comments of, like, just ask me about how the kids are doing, whereas their mom got asked, well, who's with the kids if you're here? Constantly this assumption that for her, it was her job to take care of the kids, where I was seen as like, oh my God, you changed a diaper. Wow, you're such an incredible father. So there were all these subtle ways that people who were our friends and colleagues and meant absolutely no harm would constantly be giving me all this validation for doing all the same things that she did and got absolutely no validation for, and sometimes got judgment for.
Yeah, and I will say, I mean, sometimes it can come from unlikely sources. So my mom actually once said, well, just don't complain too much. You should take care of the kid more because, your husband's job is basically to bring in the money. So, like, I know you work, but like, basically, like, don't complain if you're taking on the bulk of the child rearing. Which was frustrating. I mean, coming from your own mom, I mean, I think, yeah, anyways. So it can come from a lot of different sources. So let's talk about the different ways that it can manifest itself in actual outcomes. So researchers actually sent out identical resumes to different hiring managers, and each one received one version. The resume itself was identical except for the name. So some hiring managers received a resume with a Black sounding name like Lakeisha or Jamal. Others received a resume with a white sounding name like Emily or Greg, and yet others received a resume with a Latinx sounding name like Maria or Pedro. And they found that the white applicants received 36% more callbacks than equally qualified Black applicants, and 24% on average more callbacks than Latinx folks. So if you can't even get in through the door, you certainly don't have a seat at the table.
And these kinds of things can play out in law enforcement as well.
Can I ask a quick question on that?
Sure.
That last topic in the research, was there, I didn't hear it, was there a distinction between male and female applicants in any kind of hiring process? I'm just curious if that plays out similarly.
Yeah, that's a great question. I'll have to go back to the original study. So this is the 2017 study that's cited here, because I can't remember exactly what happened with gender. I mean, I feel like it probably mimicked the gender gap in certain industries in a way that was consistent with the past. So they probably didn't focus on that. They may have just focused on race and ethnicity, but they did have it vary by gender. So they must have at least analyzed it. So I don't remember the exact findings, but they should be in that paper.
Awesome, that's helpful. And I guess Nicole mentioning, the comment that she heard from somebody just jogged that for me, that you wonder if the same bias around as you pointed out earlier, the family connection is problematic in the same sense.
Well, I oftentimes also think, though, it depends probably by industry, because if it's like teachers or childcare or nannies, I would assume that people might have an implicit bias towards females or nurses, right? But then when it comes to other industries, especially leadership or maybe law enforcement or something, I mean, I don't know. I'd have to look into the data. That it is specific to industry, I would guess.
Think of some of the terminology we use. It's a nurse. It's either a nurse or a male nurse, and you're either a nurse or you're a male nurse if you're male. And then if you're to the fathering example, the parenting example, if you're a father out in public with your child, you're babysitting. You're not parenting or fathering.
Exactly. My friend once got that, was at the grocery store with his sons, and somebody came up to them and said, "Oh, are you sitting for the day? Are you giving the mom a break?" And he said, "No, this is called parenting."
But again, it rolls off people's tongues so often because it's just kind of how we've been conditioned, and it's not oftentimes that people don't mean anything bad by it, and yet again the impact can be very limiting, and the impacts can be more severe as well. So if we look at law enforcement, there was a study done in 2019. They looked at over 100 million police stops in 31 states, and they found that Black and Latino drivers were twice as likely to be searched compared to white drivers. Now, one of the things they found was that this disparity about one who was stopped went down dramatically at night. So if you think about, well, what's going on at night versus the daytime, at night you can't necessarily see the skin of the driver, the color of the skin of the driver, so that implicit bias doesn't get triggered. Whereas during the day and the daylight, I see the skin color and my implicit biases, if I have them, may get triggered. But like I said, they found that Black and Latino drivers were twice as likely to be searched. They also found that Black and Latino drivers were searched on the basis of far less evidence than white drivers. So when they looked at why it was that the police officer who made the stop decided to search the car, what they found for white drivers was a very kind of clear-cut evidence-based reason. Whereas for Black and Latino drivers, it was more of kind of a gut level call. Now, on top of all of that, they found that Black drivers were actually less likely to be found with contraband. So one, we can see, the fact that the stops occur more during the day is a clue that potentially racial profiling is going on. The fact that there's far less evidence required before causing a police officer to search a Black and Latino driver is again kind of showing that this is the reasons are being triggered by race. And so for moral reasons, we could say that this isn't fair. But for law enforcement reasons, we can also say it's just not effective. If the purpose of searching someone's car is to find illegal activity or substances or things like that, and what's triggering people is actually steering them away from criminal behavior, then implicit bias is not only hurting people, but it's undermining the effectiveness of law enforcement. I think this goes back to some extent to the conversation we had earlier on around training and data. If there's clear data telling me to search someone's car, then I act on it. But if it's not clear data, I may be actually going in the wrong direction from where I'm supposed to be going. In Washington State, they looked at also the rates of stops against Native Americans. They found Native Americans were 5 times more likely to be stopped and searched than white drivers, and again, less likely to be found with contraband. So it's important to look at, kind of not only what's the impact of implicit bias, but again, how does it limit or undermine our effectiveness? We see this in education as well. So Black students, especially boys, are disciplined more often and receive more out-of-school suspensions and expulsions than white students who commit the same offenses. And this starts as early as preschool. So you think about, what does it take to get someone suspended or expelled at age 5 or 4 or 3? They also found that Black students were 3.5 times as likely to be suspended or expelled by their white peers, and over 70% of all referrals to law enforcement or discipline or in-school related arrests were to Black or Hispanic students. And kind of similar to the stopping and searching of drivers, they found that African-American students were referred to the office for less serious and more subjective reasons. And so again, for white students, it was a clear violation of education code. They had an illegal article, they had drugs, they had weapons. For African-American students, the number one reason is often defiance, speaking out in class. Well, who's to say whether behavior is defiant or assertive? We know that this happens a lot, that the same behavior is interpreted differently depending on who it's from. So a white student speaking out in class is seen as a leader and assertive, and a Black student is seen as defiant. We see this around gender as well, that when men speak up, what do we call a man who speaks out and speaks his mind, typically?
Assertive.
Assertive. What do we call a woman who speaks out and speaks her mind often?
Opinionated.
opinionated, and usually not in a good way. We often kind of say it, with a tone that implies that that's somehow problematic. We often hear bossy, emotional, or some other words that I'm not going to share here. But we can see how the same behavior coming from the two different people can be interpreted in very different ways. I saw Janessa also talked about men who speak up being confident. Okay.
So I want to talk a little bit about this idea of self-fulfilling prophecy. People sometimes rise or fall to the expectations that you have of them. And it doesn't really have to do with who they are, but it's about how you're treating them based on your expectations of their behavior. So there's this classic study in 1968 where researchers went into third grade classrooms and gave the students IQ tests. And they went to the teachers and they said, okay, based on the IQ test, all these students over here are bloomers. This is their year to blossom. They're really going to develop and come into their own. So they're bloomers. All the other students are non-bloomers. So this is just not their year. And sure enough, at the end of the year, when they gave them another IQ test, they found that a higher percentage of the bloomers in green gained 10 IQ points, some even gained 20, and some even gained 30. And across all those IQ levels, more bloomers than other students, non-bloomers, had these gains. Well, here's the kicker. The researchers actually randomly assigned the students to be in the bloomer or non-bloomer group. They didn't even grade the IQ tests at the beginning of the year. So if that was the case, what made the bloomers actually bloom? Yeah, so Linda says positivity or expectations or, encouragement. So, again, the teachers aren't bad people. They're not waking up in the morning thinking, oh, I'm going to treat this student differently than that student. But, they may have subtly or unconsciously done certain things like, turn to them more in class or smiled at them more or encouraged them more or gave them more feedback on their work. So, the students rose or fell to the expectations that they had of them based on how the teacher treated them. So sometimes students tell me, Dr. Saad, aren't stereotypes there because they're based in a kernel of truth? And I say, I don't necessarily think that's the case, but even if it were the case, it's not that people are inherently like that. Sometimes the way that others treat them will elicit that stereotypic behavior out of them because people rise or fall to the expectations that you have. So let's say that I think that Jared is a really aggressive person. So I go into his office and I'm just ready to argue because I know he's probably going to argue with me and I'm barking orders. Well, anybody being spoken to like that is going to be defensive, and I might interpret that as aggression because it fits my narrative, right? So again, I think self-fulfilling prophecy has a lot to do with it. And here's a specific type of self-fulfilling prophecy. So maybe some of you have heard of stereotype threat. Back in the 1990s, famous social psychologist at Stanford, Claude Steele, noticed that African Americans at Ivy League schools, not just Stanford, but Princeton, Yale, Harvard, were dropping out at higher rates than their white peers. And he was concerned. So he ran a series of studies that showed that it turns out when you're in a really high stakes situation, like you're taking the SAT, you're taking the GRE, you are taking the test to become a healthcare professional, you are in a really difficult math class in college. Any subtle reminder of your ethnicity or your gender or any group that you belong to can automatically activate all the associated stereotypes. So for Black students, the stereotype is they're not good at school. For women, the stereotype is they're not good at math or science. So, when they're in these situations, and we know the SATs ask about race and gender before that you take them. So if I mark race or my gender, now all the associated stereotypes are automatically being activated. Well, unconsciously, now I'm trying really hard to disconfirm the stereotype. But in doing that, it takes away from my concentration and then I underperform, ironically confirming the stereotype. So there are ways to remove the stereotype. So don't ask about race or gender before they take these tests, or don't bring it up when they're in these high-level math or science classes. You can also say things like, we know that this is difficult for everybody, and there's no gender differences, there's no racial differences that are merited here. So when you have stereotype threat at play, so you remind them of their race or gender, or you don't mitigate it in some way, we see that African Americans underperform compared to whites. But when you remove stereotype threat by not asking those questions or saying there is no racial or gender differences, then Black performance raises to be equivalent of whites. So this tells you that it's not because they're not capable. They are capable. It's just that the stereotype is creating this environment that creates too much pressure, and they try to go against that pressure, but they choke under the pressure and underperform. So I'd like to just open it up. What are you know, we've gone through various sectors, law enforcement, education. What do you think are some of the ways that implicit bias plays out in the work of healthcare professionals?
I'll speak about one just that happened recently. I've started to notice, be more conscious and aware of how we document homelessness or the challenge of homelessness for individuals. Sometimes I think, and it's something that I became aware and want to coach about it, because some of the notes don't mean to be that offensive, but they kind of take on that, and they take on that somehow this person is non-compliant, or is going to not follow through and things like that, when if given the right plan of care, they may be able to be successful. And I think that we can do a better job of describing them as challenged by homelessness, or homelessness presents a challenge for these individuals. And I think it's a great example of how easy it just creeps in. And, a lot of homeless are white, and it's not, it affects all types, colors, socioeconomic status. But I think, I observed that, and it was something I became more conscious about and wanted to change that.
Yeah, thank you, Linda. I think, documentation is a very fertile ground for implicit biases to creep in healthcare. And then you have to think about, it's not just the person writing the report, but who's going to read that report later. And I think you're really hitting the nail on the head of like people blaming someone's personality for their predicament rather than taking the situation into account. So they are challenged by homelessness. It's not that they're homeless because they're like this, and that also means they're not going to follow through. I actually have oh, go ahead.
Oh, sorry. I was going to mention just another example that I had a former member of my team bring forward, and one that I've seen now repeated, that our environment, or the built environment within healthcare, is set up in a way that it is not open and accepting of other people. So one of the examples completely blew my mind 3 or 4 years ago, I was given by somebody, is when paramedics or nurses or doctors or anybody does a physical assessment on a patient, one of the first things that they do is they check skin signs. And the perceived normal and okay is if you are warm and dry, but the first word there is pink. You're pink, warm, and dry is how you determine that somebody's okay. Or the universally used tool, mnemonic, for a newborn, whether it's in the hospital in an OB ward at home or on the side of the road as a 911 call, is a tool called APGAR, and each one of those letters means something. And APGAR, again, values your healthiness based on your skin color. And there's no, there is no tool, there is no crosswalk available in our world today for either one of those tools for a baby of color or a person of color. And to this day, that is mind-boggling to me, that it hasn't been corrected, and that we haven't adopted something. The same goes for how we take how we account for gender in our documentation. So, so our documentation system today is male, female, or unknown, but that doesn't account for transgendered individuals. It does not account for people who decline or are non-binary, decline to state. It doesn't account for male to female or female to male. And forcing them into the category of unknown is entirely disrespectful when they get that record back, that they weren't able to be identified by who they are. Those three examples jump out to me as just offensive and something. It's still sad years on that we haven't been able to fix those issues.
Yeah.
And like you said, all of them have fixes. You know, we did some training here in Santa Barbara with Cottage Hospital, our major hospital, on their intake forms to just help them expand the categories on their intake forms around gender, immigration, things like that. But those are and we'll talk more about this on Thursday of, you know, how do we change policy to then change our thinking and potentially our impact.
Yeah, I think those are excellent examples, Brian. Thank you.
I think also we've seen this play out a lot in pain management. I know that some states have taken on pretty significant studies to show the disparaging between treatment of pain in white patients versus Black patients, where the Black patients are typically under cared for their pain management. So there's just a bias there that med seeking, and I've seen it in my, you know, I worked in Richmond, California for a very long time as a paramedic. So, you know, you work in that area, you get med seekers, people that are seeking pain meds, and you get some that are obviously in legitimate pain. But you know, as a paramedic, you're there to treat people and to make them more comfortable. But it was pretty sad when the studies came out when they actually showed that they were undertreated for pain management, the African American community.
Yeah, that's actually a great point and a great segue, Nicole, into the video that I'm about to show that actually documents that one of the most well-established areas in healthcare that is susceptible to implicit bias is pain management. So let me go ahead and play that now.
So in healthcare, bias comes in various forms. And I would say there's three primary ways that we could actually track bias. One, of course, is in interpersonal interactions, let's say between a patient and a provider. So the unconscious ways that we may have associate certain groups, certain gender identity, people with certain gender identities, people from certain racial or ethnic backgrounds, manifests in the diagnoses we're making, the interactions we're making with the patients, as well as the warmth with which we're working with them, which impacts the amount of trust that they have in the providers themselves. How does that manifest? One of the major ways that's been studied and shown and reported over and over again is pain management. So patients with darker skin, African Americans, receive lower dosages of pain medication across the board, from infants to the elderly, for the same types of ailments they come to practitioners for, because of assumptions that are being made around addiction or their ability to actually be truthful around what they're experiencing. The second way bias really plays into all of this, particularly unconscious bias, is the internal dynamics of organizations, how employees and staff members communicate with one another, team collaboration, team dynamics, but as well as performance reviews around compensation, who gets to be promoted, who gets to be a leader of an organization, of a team, based on assumptions that we may have about those people, purely based on phenotype, their origins, whatever that may be. And the third way bias really plays out in healthcare, and this is, quite well documented across the board, is its costs, wasted costs. So racial bias, just one particular identity that we're concentrating on, costs the US economy, the healthcare system, $310 billion a year. And for me, I just want to think about what can we do with that money if we didn't have bias in the world.
So I just wanted to talk about that a little bit because it's an important point of, you know, there's these three kind of main areas that implicit bias can play out in healthcare. And one is in interactions, you know, healthcare interactions between provider and patient. The second one is in compensation and promotion and sort of the team dynamics. And then the third one is in cost. And he didn't really elaborate, but it's more of in terms of services that they have to come back for because the treatment wasn't explained well enough, or things were missed, so now they have to have remediative services, medical malpractice, things like that. So I actually found this really interesting meta-analysis that highlights this implicit bias in healthcare. And number one, it found that implicit bias is prevalent in healthcare. So it was a meta-analysis of 15 studies, and it found low to moderate levels of implicit racial and ethnic bias among healthcare professionals in all but one of those studies. And how does it affect it? Well, it's related to patient-provider interactions, and then treatment decisions based on those interactions. So if you have bias in the interactions that's not allowing people to feel comfortable enough to tell you about their symptoms or their trajectory, that's obviously going to affect the treatment decisions that the provider gives. And then, based on how they're treated, they may not be confident in the provider. So then they may not adhere to the treatment, which causes problems and more cost. And then obviously it affects patients' health outcomes down the road. So what we know is that some of these studies indicate that physicians with higher rates of implicit bias spend less time and explain the treatment less well to Black and Latinx patients compared to white patients, even controlling for the illness or injury. And as a result, those patients have less confidence in their physicians and adhere to the treatment less well. And this has even been shown in oncology patients. So obviously, if you're not, explaining the treatment well, they're not going to adhere, and that can be very consequential. But as Nicole pointed out, one of the largest areas in healthcare where, implicit bias creeps in is pain management. It's very well established. And so, they have done these studies that show that emergency room physicians, for example, will give less opioid-based pain medication to their Black and Latinx patients compared to their white patients, again, even controlling for the severity of illness or injury. And you have to remember, these aren't bad people. These physicians aren't waking up in the middle, waking up in the morning thinking, I'm going to give my Black patient less pain meds. But it's based in these automatic assumptions that come to mind when there are decisions that have discretion in them. So if you're deciding whether to give pain meds or how much pain meds to give, you might be relying on things that automatically and unconsciously pop to mind, like, are they more likely to become addicted? Even though we know from the opioid crisis that Black and Latinx patients are not more likely to become addicted to opioid-based pain meds. Or do they have a higher pain threshold, so thicker skin, literally? Do they have, are they being truthful about needing this medication? So Nicole, you mentioned this in terms of the med seekers, right? It can affect the relationship with the patient. So among Black patients, physician implicit bias was associated with more clinical verbal dominance, lower patient positive affect towards the provider, but also towards the health system in general. Poor ratings of interpersonal care, longer visits. So sometimes shorter visits because they spend less time, but sometimes they actually have longer visits with patients of color because they have slower speech. So they're thinking they need to slow down their words because the people don't understand them. And less patient-centeredness overall. So I want to talk about why does health equity matter? So I like this video. Again, it's from the Institute for Healthcare Improvement. And it talks about, why do racial disparities matter? Why is it important for us to pay attention to them? And what kinds of impacts and areas do we have to pay attention to, not just within the healthcare system, but, outside of, outside of the clinic. So population health and public health. And he tells a really poignant story in here that I think is very important. So.
Okay. If you need me to turn up the volume, or if you're having trouble hearing, let me know as we go.
Health equity is important to me because it's a piece of the larger problem of social justice. I think we have become in the US and many other countries an unjust society, failing to attend to the needs of people who start off with or fall into positions of great disadvantage. And I just don't like that. I don't know why. Maybe because I grew up in a small town where we kind of took care of each other, but no, we can't. I don't want our society to be one in which we turn away. And to me, health equity it's a symptom of a larger, crucial issue, the fabric of communities in our society. I guess the other reason is I'm a doctor. I don't practice anymore, but when I did, about maybe half of my patients were under conditions of enormous stress on Medicaid, in poor families and broken homes, and I could see the challenge, and frankly, I felt helpless a lot. That the kid with asthma who came back and back and back because there was no heat in their home, or because we couldn't get the home clean, or the child failing at school who becomes depressed because their self-image is hurt, and then the vicious cycle begins. Poorer sense of self, less effort, more failure, and you could see the cycle penetrated. I could give pills, or I could treat fevers, but that wasn't creating healthy futures, and so it meant a lot to me. There's a case I've written, a kid I've written about quite a bit. It's a real story. Some patients stick with you. So this young guy, he was a 14-year-old when I met him, was in deep trouble. He was drug addicted. He at 14, he had his first gun when he was 5, and he was in and out of trouble, and then he got leukemia. He got acute lymphoblastic leukemia as a 14-year-old black child, which, is, you may know, is an extremely difficult disease. For some reason, acute lymphoblastic leukemia, which you can cure easily in a 5-year-old white, it behaves really badly in a 14-year-old black. But we went to the mat. This kid got everything. We got him a bone marrow transplant, sophisticated chemotherapy, walked him through great difficulties, and he was cured. His leukemia went away at 17. There was no trace, and we remained in close touch until he died at age, I think he was 29, on the streets. He basically fell apart and ended up having a seizure due to drug abuse, and he cured leukemia and killed by poverty. Yeah, killed by disparity. He wouldn't. I've often said he would not have said that. This kid never ever blamed anyone but himself. It was really interesting. He internalized this, but I say that. I can't forget that kid. That is a really powerful story.
So I think that I like to show that video, one, because it highlights not just what happens in the clinic, but also the population health and public health. So what does it mean to focus on healthy foods or outreach, or getting people outside, or getting houses cleaned, or making sure that everyone is living the quality of life that facilitates healthy futures. And it also really affected me, that line that he said at the very end: cured leukemia, killed by poverty. I mean, it's like, you know what I mean? So it's like, it's the larger picture of what do we do, not just with the racial disparities in the clinic, but the racial disparities that lead people to the clinic. So that's why I like that video.
So we want to go ahead and start talking about the now what portion of the workshop. So now that we understand, one of the very real consequences of implicit bias and healthcare disparities, what can we actually do about it? So on Tuesday, Carmel kind of framed implicit bias as a habit of the mind. And if you think about any other bad habits that you may have in your life, we tend to fall back on those bad habits when we are feeling time pressure. In other words, we are feeling rushed and we don't have the time to stop and think and act on our best interest. When we're feeling fatigued, stressed, or distracted. So the first thing that we can do to try to reduce the likelihood that our implicit biases will impact our behavior or our decision making is to improve the conditions that we're operating under. In other words, how can I remove the time pressure or reduce the time pressure I'm feeling so I'm not feeling so rushed, so I have time to pause? How can I reduce my fatigue, stress, or distraction? So we want to start by just asking you, what are some things that you currently do to give yourself some more time in the day or in your work life? What are some things that you currently do to prevent or reduce fatigue, stress, and distraction? And we'd love to hear some folks. If you want to take off your mute, feel free. You can also share in the chat box, but want to hear what kind of strategies you're already using. So, oh, Nicole, I see your lips moving, but I can't hear you.
Sorry, how's that?
There you go.
So I started doing this, blocking off an hour of my day as private, because I do share my calendar. So it's blocked off private. I had it initially as catch up, but then I found that like a catch up hour for my day, but then I found that I was filling it with things, even though I was trying to consciously set aside that time. So I actually changed the title to mental health hour because just so it gave me a little extra piece. Like, do you really want to fill this in because you really need this time to either call that person back that you couldn't call because you're on meetings? And I think especially now in the world of Zoom that we're in, there's no more drive time to meetings or kind of a decompressing to and from meetings. And so things just tend to, there's 15 minutes there. Let's get that in. So, my husband and I joke sometimes when we work from home, if our day starts early and the other one is hanging out or dealing with the kiddos, then sometimes it's not until 4 p.m. when we realize we haven't even brushed our teeth. So just because it just gets, filled up. So I really try to purposely block that site, but I did notice that I was filling in anyway. So I changed the title to mental health break so I could really think if I wanted to fill that time or not.
Yeah, I hear you there, just really setting those boundaries and really kind of planning in downtime, planning in break time, planning in time that you try not to fill up. I'm seeing in the chat box things like walking on breaks, building Legos, having a nice frosty beverage, turning off the news. So all of these things are things that we can do to kind of, give ourselves that extra time to pause. Taking walks, it does a number of things. It gets us moving, which can kind of reduce fatigue. It gets us out in the daylight and the sun, which can increase energy as well. Other strategies, yeah.
Taking a shower, like, I don't know, I feel better after I take a shower, it helps out.
Yeah, just the water, splashing water on our face or taking a shower and kind of getting refreshed, but also just taking some time, downtime, taking time where I'm not having to think about all the other things I have to do. Yeah. So
yeah, it's also something about the warmth, the warm water, and just helps you relax and sort of let go.
Yeah, absolutely. So these are some strategies that we can use to kind of, again, reduce that likelihood that we're operating under conditions that breed implicit bias. And they may sound small, but they actually have quite a bit of potential to have impact. And so Carmel's going to share a study that can kind of show just how much impact things like this can have.
So this is an interesting study that I found from several years ago, and it was done on judges who were making really important decisions about parole applications that came in from prisoners. And these prisoners have committed crimes anywhere from breaking and entering to murder. So on the horizontal axis is the time of day, and the 2 dotted lines are the judge's 2 food breaks. And on the vertical axis is the percentage of favorable decisions that they made to actually give the prisoner parole. So what we see here is that, you know, once the judges come in first thing in the morning, they're granting parole to about 65% of the applications. But as they get closer to their first food break, and maybe they're getting hungry or fatigued or hangry, maybe that drops down to 0. And then they have their first food break. And then after that, it pops right back up to 65%. And then as they get closer to lunch, they're getting hungry, tired, fatigued again, and it drops down to about 10%. Then they have their lunch break, pops right back up to about 64, 63%. And then as they get tired towards the end of the day, it drops back down to 0%. So it's unlikely that all the good applications came in first thing in the morning and all the really bad applications came in right before lunch. What's more likely is that judges are human too, and they can be susceptible to hunger, fatigue, distraction, things like that, affecting these really important decisions that are on that affect people's lives. So they're very consequential decisions. Now, I'm not saying they don't take it seriously. They take it extremely seriously. Judges are very deliberate and methodical in these decisions, but it's important to realize that judges, just like all the rest of us, are human, and our judgments can be affected when we're under these, these conditions of depletion. Also under these conditions of depletion, you can see the racial disparities widen, because that's where the habit of the mind, implicit bias, takes over, because you're tired, distracted, stressed, rushed, fatigued, busy. So you fall back on your implicit biases, which could create even more disparities among racial, ethnic categories, among gender, etc.
So this is an example of how it plays out for judges, you know, that getting hungry, getting distracted, getting fatigued can lead to making worse decisions in terms of their the cases that they're deciding. How might this play out for you? Can you think of examples where there are certain times of day, certain periods of the week, certain patterns that play out in your work life where you think, like, you know, this is an opportunity where implicit bias could creep in or be more likely to creep in, given the nature of our work? Okay, so I'm seeing when I'm tired. And are there certain parts of the job that make you more tired, or certain things about the nature of the job that that are more likely to kind of make you tired? I know, you know, for example, one of the things we heard in the last session was, you know, at the end of a long shift, if I'm an EMS driver, at the end of a long shift, I'm more tired, more fatigued. That might be a time where I'd be more susceptible to implicit bias. But how about for others? What do you think?
I would say when I don't get enough rest, I'm tired the next day. So like in the morning, it affects my day from my sleep routine.
Okay. Yeah, certainly, you know, accumulated lack of sleep, you know, the previous day can certainly impact us the next day.
Yes. Also, like not eating right, or not eating, lose focus.
Absolutely. And, you know, so one of those things to think about is then, you know, I know for myself, when I get more stressed, I tend to eat even more poorly, which kind of creates this cycle as well. And it's, you know, what I should be doing is, when I'm feeling more stressed is when I should be even more careful about what I'm eating, and eating those foods that are going to give me more energy. That's not the way bad habits work usually. Any other thoughts? Well, as you continue to think about that, you know, so there's a couple of things we can do about this. So, you know, Kaylin, you mentioned, you know, if I don't get enough sleep, then it affects me the next day. So one thing I can personally do is get more sleep. And you all talked about things like turning off the news and relaxing, lighting a candle, reading before bed, Sudoku, things like that as individual level strategies. But there's also institutional level changes that we can make. In other words, are there things that are there policies that we can change in our work environment? Are there structures or aspects of our organizational culture that could be changed that would not just improve the conditions for me as an individual, but for everyone in our organization? And so I'm wondering if you can think of anything like that, something that's just more, not so much about your own personal work life, but it's kind of endemic to your field, to your department, to your particular role, that a new policy, a new culture might change that would improve conditions.
Yeah, for me, it's tough. I think that I come from a union environment, so I'm trying to think of it from that perspective, because again, it has to go through 5,000 people to become implemented. Everyone has to agree. So, you know, we have scheduled meal breaks for our folks, so we try to anyway. It's not always possible, but we do attempt to do that. But again, it's the 911 system, so it's kind of, you're at the mercy of the need.
Yeah, and you know, and that's part of why we encourage people to think about these kind of institutional level changes, so that, you know, if I'm meeting with other department heads, if I'm meeting with my team, if I'm meeting with our union, you know, one, what are some of the things that we should talk about changing in order to improve the conditions, but also this might add some additional leverage as we're trying to bargain for improved conditions, because, you know, improved conditions, we're not just asking for them because they make us feel good. We're asking for them because they could reduce the likelihood that implicit bias will play out, and therefore improve outcomes, improve the very, you know, life-saving outcomes that we want to see. Right. So again, we just encourage you to think about this. This is a tool you can use, again, in organizational meetings, team meetings, leadership meetings, union meetings, whatever the case may be, wherever you have a chance to talk about policy, practice, structures, and the culture of your field or your organization. Having conversations about these 4 conditions can be very helpful. So now we're going to move on to the next set of strategies, which is really more about individual level strategies. But first, Carmel is going to talk a bit about what doesn't work.
Yeah, I want to talk a little bit about the ineffective strategies before I talk about the effective ones. So I just want to remind you that we can't really change implicit bias, or at least that's what the research says. But we can implement these evidence-based strategies to at least disrupt the impact that implicit bias has on our behavior, which is what we really care about anyway. So I want to go over things that people think can help, but really don't. So because we know we can't reduce implicit bias itself, but rather just override its impact on our decisions, we're gonna refer to as bias override instead of debiasing or unbiasing. So the first thing that doesn't work is stereotype suppression. So some people think, oh, we can just use willpower to not rely on stereotypes. We can just banish it from our mind. We can just try not to stereotype, but that's not effective, because even if we think we're successful consciously, these implicit biases can exert an unconscious effect on our behavior, and we wouldn't be aware of it. And we can't willpower away what we're not aware of. But also, the other thing that people tend to do is when they realize that they've relied on a stereotype, they try to, you know, push it out of their mind, act like it never happened, and just move on. But like I said before, I actually encourage people to do the opposite. Okay, I've relied on a stereotype. Where did this come from? Where did I pick up this association? Was it media? Was it family? And then who else has it affected besides the person right in front of me? So in my case, I'm an educator. So if I stereotyped a Muslim student, I could ask, you know, which other Muslim students have I affected in this way in the past, right? And then actively replace it with a non-stereotypic thought. And that's why we refer to it as a habit, because if you get used to catching yourself and replacing it with a non-stereotypic thought, then that will become a habit in and of itself, and it'll be much easier to do in the future. So the other thing that's not effective is color blindness, or at least what we used to call color blindness. And, you know, this was a noble idea that people had, and they said, you know, if race relations are causing so much problems, then let's not focus on race in the workplace, right? So I'm just going to focus on the fact that people are my colleagues. So Jerome is not, you know, a Black man. He is just a fellow coworker at this company, or he's a fellow nurse or a fellow EMT or something. So that seemed to be a good idea, but it turns out that it's not. Number one, because it's not possible. We see color, and, you know, to act like we're not picking up on these racial and ethnic markers is just fooling ourselves. But the other reason it's not good is it's not desirable, because people's racial and ethnic identities are an important part of who they are. And so when you deny them that opportunity to bring their full selves to the workplace, they oftentimes will become less productive, less creative, and less engaged, because they can't bring their full self. You're robbing them of that opportunity to bring their unique lived experiences into the workplace. So, what we know about diversity is not only is it good for people to talk about their diverse experiences in the workplace, but it's also better for the workplace. So we know that jurors, for example, diverse juries make better decisions. Executive meetings with more diversity are less susceptible to groupthink, or the crowd mentality that Bill was talking about. And when we look at like the bottom line, businesses in the top quartile for diversity, gender and ethnic diversity, tend to have bigger bottom lines. So we know that diversity is a feature, not a bug. And so we want to enhance that effect of diversity, not squash it. But back to this issue of sort of robbing people of their unique lived experiences by trying to be colorblind. I found this really great quote by an African-American woman in the Atlantic a few years ago. And she says, "You can't have people saying they don't see color. I'm a Black woman, and if you're telling me you don't see color, you're telling me you don't see the injustices that I faced, the struggles that I have, and you definitely can't celebrate my culture." And I thought that was a really poignant quote to kind of exemplify the problems with color blindness. So nowadays we actually go the opposite way. It's called multicultural ideology, where we not only recognize people's unique ethnic and cultural backgrounds, but we celebrate it. Almost like we want to invite those diverse perspectives into the room, almost like different pieces of a puzzle. Nicole, you had your hand up.
Yeah, I was wondering how, I'm trying, aside from the workplace also, I try to apply this to my kids. And I catch myself, I grew up, I'm 45, but I grew up with the don't see color blindness. But I notice with my kids trying to find that balance, if there's a Black child at the park, I would say, oh, the little girl in the yellow dress. I was trying to, I spoke to this yesterday or on Tuesday also, trying to catch myself to make sure that I'm being respectful and engaging in a respectful way. But even trying to get my kid, it's like hard for me, who tries to be conscious of what I'm saying, to try to not put that on as I'm raising children, to not be colorblind, but then not single people out, if that makes sense, trying to find that balance. So I catch myself, there's the little girl over there with the yellow dress is trying to get your attention, trying to avoid saying the little Black girl over there wants to play with you, because in my mind, that's completely contradicting what Lex Scott is saying in her quote, right? I'm pointing that child out that she's Black when that's not my intent, but then I might be screwing it up by not acknowledging that. So that's something that, and same thing with the workplace, right? Our workforce isn't a very good representation of the community that we serve. So trying to get people representative of the community we serve into management is difficult, because they're not even a part of the workforce. And then trying to not, if it makes any sense, trying to not, quote, target that group that we're trying to bring in, because I feel like, well, is that going to be taken as the wrong way when I'm trying to target? I want the diversity. I want that to come into our environment. And I want to have a better representation, but then at the same time, I'm afraid to offend if I put that straight out there. If that probably doesn't make any sense at all, Carmel, but
No,
I'm trying to articulate.
Yeah, no, I really appreciate it, Nicole. It makes a lot of sense. And actually, I think it's very honest and very open and and I think it's a good conversation starter. So first, what I would say is, yeah, I've also felt that tension of like, I shouldn't be identifying this person by their race. And, truth be told, that's not exactly what we mean by color blindness. It's more of like when somebody is in a group that you're in, explicitly saying, you know what, we're just not going to talk about race. We're not going to bring our own, personal racial experiences into this conversation because it's not helpful. Well, that has the unintended consequence of, one, making people less engaged and less comfortable in the environment, but also not contributing well to the discussion anyway, because diversity of opinions does lead to better decisions. So it's a little bit different than identifying people. I know what you're saying in that, you don't want to call attention because that shouldn't be the most prominent thing about people, but I almost feel like people see it anyway. And the thing comes when you don't want them to hear you because you don't want to make them feel like that's the only thing that defines them. So I would probably say the same thing, like the little girl in the yellow dress, just because I don't want, not because I don't think my child sees that she's Black, but more of like, I'm not trying to say like that's the main thing that defines them.
I'd say that also, like you said, Nicole, it's that balance, because if I'm going to great lengths to like avoid saying the skin color, my children can also pick up like, why won't he say that? Is there something wrong with that skin color?
Exactly. Right.
And so,
Right.
it's that, oh, the girl in the yellow dress over there. Which one? Oh, the one with the brown skin. I mean, it's just, how do we do it in a matter of fact way? And similarly, as you're talking about with, employees, there's a difference between like recruiting someone only because they're Black versus noticing, hey, we have a disparity in our workforce here. What's going on? Could there be some barriers that are preventing Black members of our community from applying or feeling interested, or stopping us from seeing them as good quality employees? So it's kind of, it is a balance, certainly, but I think it's always looking at, what's the underlying thing going on here that's creating this disparity, and how do we correct that, as opposed to just saying, well, let's go find some Black folks off the street and just, get them in here.
Yeah.
Which isn't what I heard you saying, but there are definitely ways to do it that are tokenizing, and there are ways to do it that are very authentic and helpful.
Yeah, I agree with Jared. I was going to say, I think, I think it comes down to the needs of the organization and what the organization, what the goals of the organization are in terms of diversity and inclusion. But also, yeah, just getting to the root of, well, why is there disparity in the first place? Is there something about this profession or something about this this particular organization that is turning people off from applying? But also, I also think that, Jared mentioned tokenizing. Like, you definitely don't want to tokenize people, but it's hard sometimes because when you have an underrepresentation in an organization, so you have a leadership team that doesn't have a lot of people of color, well, you want to include them, but you don't want to tokenize them. And tokenization, I'm defining as just including them, but not really paying attention or not really taking their opinion seriously. So I think this is where the difference that Jared made earlier between diversity and inclusion is really important. It's not just about diversity. It's not just about hiring or having diverse faces. Are we actually including them? Are we including their opinions? Are we including their contributions? Great, thank you. Those are great points. Thanks, Nicole. So the last thing that's really not helpful is shame, blame, and guilt. So while it may feel good to call people out for their insensitive remarks, it's counterproductive. One, because people can get really defensive and actually cling to their biased attitudes even more. But also, it's not about shaming and blaming. We know that demotivates people. It's about having an open and honest, constructive conversation about these issues. And also, allowing people to sort of work through these issues and gain a sense of awareness. That's what this whole workshop is about, is enhancing awareness of issues that we all are already somewhat aware of, but enhancing awareness and then equipping people with the strategies to disrupt the impact of bias on their behavior because it's unintended, right? So it's really having that constructive conversation. So I'm going to show you another video. So this is also from the Institute for Healthcare Improvement. And the reason that I like this is because the two doctors are actually talking about how to implement the strategies from the Breaking the Bias Habit framework specifically, the one that we're using specifically in the healthcare context. So they talk a lot about things like individuating instead of categorization. Categorization is just social stereotyping. But they talk about perspective taking. They talk about counter stereotyping. So I like this in that it's really applying the strategies that we're about to talk about in a healthcare setting. So it's just a few minutes, and just let me know if the volume is okay.
Is there a remedy if I'm a physician or a nurse and I believe what you're telling me, which is I don't believe I'm racist or acting in such a way, but there are unconscious biases at work. Can I unlearn them? Can I work my way out of it? And if so, how? There are a number of strategies that have been shown to be effective. One of the basic override, well, I would say two things. The first thing is to realize that that could be me. The typical healthcare provider, I had many talks to medical, nursing, and other health professional groups after the Institute of Medicine report came out. And the typical healthcare provider in the United States would say, I would never do that. I would never provide less pain medication to a Black patient than a white patient. Whereas the evidence is clear that Black patients get less pain medication with similar levels of conditions. So the first thing is to realize that could be me, and that people who have implicit biases are not bad people. They are just reflecting the culture and the beliefs that they were raised with. So that's the first point. The second big principle is the challenge of focusing on what we call individuation versus categorization. What is normal for human beings as we process information is to put things into categories. So I see you, and I don't see you as a unique individual, Don Berwick, but I see you as a middle-aged white male. I've put you in a category, and in my mind, there are lots of associations that comes with middle-aged white male. So it's how do you look at a person, at your patient, at your client, and see that person as an individual, and try to understand the individual context of that person, as opposed to instantly seeing them, which is natural, because that's how we deal with the complex cognitive information we have to manage every day. We put things into categories. It simplifies life. It helps us to navigate our social world. So it's normal for us to do that. So that's one general principle. There are a range of other strategies that have been shown to be effective. One is trying to put yourself in the shoes of the other. So you have a patient who is an elderly Black male, and if you stop and wonder what his life was like, and what was it like for him to grow up in this society, and what are the things he encountered. So the extent to which you try to walk a mile in someone else's shoes, that is another strategy that has been shown to be effective. There's also a strategy that's called counter-stereotyping, which means you think that all women are weak. Well, could you sit back some days and just imagine what a strong woman would look like, and imagine that women could be strong. So those are a number, but they're broad range of psychological strategies that have been shown in very careful laboratory experiments to minimize the occurrence of it. I would say two things. One is processes of implicit bias are more likely to occur when someone is working on the time pressure. So you don't have time to think. You just default to your social categorization processes. It's also more likely to occur when you are dealing with complex cognitive information. In fact, researchers point out that many of the features of a typical encounter between a patient and a healthcare provider, the ingredients within that encounter are some of the very factors that social psychological studies show the processes of implicit biases operate.
I'll guess that fear can play a role, right?
Yes,
When you're
fear,
afraid.
anxiety will also play a role, absolutely.
So I like that video because it's really talking about some of the strategies. He started to introduce perspective taking and individuating instead of categorization. So we're going to get into those strategies now. So I mentioned that this whole workshop is based on a framework called Breaking the Bias Habit, developed by Dr. Patricia Devine and her colleagues at University of Wisconsin-Madison. And she was the social psychologist who did these really careful studies showing the long-term impact on mitigating implicit bias by utilizing these effective strategies. So the effective strategies for bias override are individuating, situational explanations, expanding exposure, perspective taking, and stereotype replacement. So we're going to go through each of these in turn and give you an opportunity to discuss and practice some of them. So strategy one is individuating. So this is based on the automatic assumption that the same characteristics describe all members of a group simply because they belong to that group. So that's just normal stereotyping. The correction is to pause, which your brain is not going to want to do because it's trying to save time and cognitive energy, but to really pause and take the time to attend to specific personal characteristics of the individual, such as family background and personality traits. So this may seem very basic, like, just stop and get to know the person. But one, it's very difficult for us to do that because we live in a very busy world and we're bombarded with stimuli all the time. And it doesn't often occur to us to stop and really get to know the person, especially when we're under those depletion conditions. But to really, to rely on a stereotype is really to rely on faulty information. So why don't we fill in that gap of information with more accurate information, which we can get from the individual. Also, a lot of people think that positive stereotypes are better because they give people the benefit of the doubt, but that's not necessarily true, because for people in that group that don't live up to the positive stereotype, it creates a lot of pressure and actually leads them to do worse on certain things than if you were to never bring up the positive stereotype at all. In addition, let's say that I happen to have someone who fulfills the stereotype. So in my case, I'm an educator. Let's say I have an Asian American student who just so happens to be good at math. If I say something like, "Oh, I guess math just comes naturally to you," well, now I'm stripping her away of the hard work and dedication that she put into being good at math. So positive stereotypes aren't much better. The last thing I want to point out about individuating is it's not being colorblind. It's recognizing that somebody's culture or ethnicity or race is an important part of who they are, but it's only one part of who they are. So it's important to get to know who that person is even within that group. So to get you practicing and talking about how this applies to healthcare settings, I'd like you to think about a time where you successfully individuated and it helped you in your work, or a time that you didn't but wish you had.
I shared with my partner that as a social worker in a medical setting, that it wasn't, I think I'm very hypersensitive to individuating just because I have had my own personal experiences of discrimination. But where I was having a challenge was with advocating for patients of color because they were being stereotyped by physicians, but then also having to counterbalance my own cultural, I guess, upbringing of not disrespecting or challenging a physician, even though I knew that was right for my client. And that was my job and my role, to advocate for my clients who were in a vulnerable position, not just socioeconomically, but had chronic health issues and mental health challenges. So just all those things operating, and me wanting to see them as an individual, but then trying not to feel like I was overstepping my role or disrespecting a physician just because culturally speaking, that's how we grew up. So it was just a lot of things operating, and then finding my voice because it was the right thing to do, to advocate for my client, versus letting my own kind of fears rule and not saying anything. when it was the right thing to do. So working with integrity, I guess.
Yeah, that's a great point, Irene. I'm glad that you shared that, because sometimes, the characteristics of our jobs can sometimes go against things that we were raised with, the personal, personal values even that we were raised with. And so for you, I think it would be even more important to individuate, because you need to know exactly what's going on, because if you are going to challenge the physician, you need to have all your ducks in a row, and you need to have all the details. And if they push back, you need to be able to really explain the situation. So I appreciate your position in that.
I have an example of a case where we had a dialysis patient that kept coming into the hospital, and of course was readmissions labeled as non-compliant because he was not going to his outpatient dialysis. I reached out to the social worker and I asked, could you please check with him? What is going on? What is causing him to be not going to dialysis? This is out in the Navajo Nation, the Native American, and he was actually busy. Winter was coming and his roof was not in good conditions, and it had rained and there was some leaking going on. And so he was focused on getting his roof fixed before winter. And so he was missing his dialysis and was coming into the emergency room once he wasn't feeling well. And so find out, the social worker worked in helping him change his schedule to the third shift, which was in the evening. That gave him the opportunity to work on his roof during the day and then have his dialysis so that he could continue to have the healthcare need he was needing and continue to work on his roof so that he could be okay for the winter.
Yeah, that's a great story too. Thank you for sharing that, because it reminds me of not just assuming something or labeling him something like non-compliant, but to really take into account the larger situation that he's dealing with, which was actually a better explanation for his behavior than he was just lazy or compliant or careless, or lazy or non-compliant or careless. And that's the next strategy that we're going to talk about. That's actually a great segue into situational explanations. But I can see where you're coming from, because these 5 strategies are not mutually exclusive. You can get to individuate someone and get to know them more by understanding the situation that they're in. And sometimes by understanding their situation, that helps you get to know them more. So these 5 strategies work synergistically, and in fact, they're mutually reinforcing. So let's go ahead and talk about that next strategy, which is considering the situation. So the automatic assumption here is that the behavior is always caused by the person's qualities or characteristics, like this person is non-compliant, or this person failed my exam, they're just not smart. It's all too easy to make that assumption, but the correction here is to really pause and consider both the immediate situation as well as chronic environment that they're dealing with. So for example, immediate situation, are they hungry, tired, stressed out, under, extreme acute distress for whatever reason? But also chronic environment. So, what is their home life like? Do they have a home? Are they feeling alienated in the current climate, either in their organization or in society? What is going on that might be a better explanation of their behavior? The problem is, it's a better explanation of their behavior for sure whenever you take the situation into account, but not many of us take the extra step to find out what the situation is. Like in the case of, oh, he really needed a roof for the winter. Well, that makes a lot of sense. Now we have a totally different view of him, right? Just like in my example that I gave earlier, when somebody cuts me off in traffic, the first thing I think is, what a jerk, or what an idiot. But if I were to take a step back and recognize the entire situation, I might have noticed that somebody cut him off and he had to cut me off in order to avoid an accident. That would also totally change how I viewed him and is a more accurate explanation of the situation. I just have to look for it. So in the same way, I'd like you to discuss in your role, in your profession, in your organization, a time that you successfully took the situation into account, or a time that you didn't but wish you had.
I was talking about how sometimes doctors in like the end of the visit, let's say a person comes in for like hypertension, right? For a hypertension follow-up. We were talking about how like sometimes doctors' recommendations are to eat healthier, right? But sometimes many patients cannot afford to eat healthy, right? Because not nowadays, most of the healthy food is more expensive than, let's say, like fast food, right? Like a McDonald's or like anything like that, right? So patients cannot afford to. So in this case, doctors are assuming that some patients can't afford a healthy diet, which is not the case for like most, because many, like let's say low income patients, they got a like certain budget that they need to um, keep up with, right? So they might not have enough money to afford that healthy food, right? So they'll go with like the whatever is cheap, right? And sometimes cheap food is not sometimes the best in like health terms. So that's an example that I was talking to with my partner about.
Yeah, that's a great example, Giovanni, that, it's not just about, oh, we got to give them pills for hypertension, but what is causing the hypertension? We have to take the context and the situation into account. They're low income, so they're eating foods that are more likely to cause hypertension than healthy foods because they can't afford it. So what kind of outreach or what kind of assistance can we offer them to get healthier foods? Because no matter how many pills we throw at them, if their diet doesn't improve, then their hypertension won't either. Good. Anybody else?
I kind of shared the same thing, as far as like, a person who has, a disability or mental health issue or something like that, to where if I am like, for example, a caregiver and they need, their sugar's high or something and they need to be rushed to, they have diabetes or something, they need to be rushed to the hospital, but in order to keep their sugar levels low, they need to eat healthy or not drink, sodas or things that contains a lot of sugary stuff. So in order to prevent that, um, you know, just for me as a employer, I would have to just, take into that to consideration that they need to, eat well and, take care of their health. So they need to go to the hospital or do whatever that happens, but do whatever to prevent those types of things.
Yeah, absolutely. Thank you, Kaylin. Yeah, it's important to understand, like, do they have access to healthier food so that they're not, having to rely on these sugary foods that they're used to, or, what kinds of resources can we offer them to help them improve?
Mm-hmm.
Great. All right, so let's move on to the next strategy then, expanding exposure. So, can we change the stereotypic messages that we received growing up in this society? No, but we can now because we're adults. And so expanding exposure is really about learning about the historical, social, and political issues impacting people from different backgrounds. It shouldn't be incumbent on the minority person to always be educating you about their culture. Sometimes we can take the initiative to understand the nuances of each culture rather than just relying on the stereotypic messages that were handed to us by media, family, friends, etc. So what does this look like? Oftentimes I use the example that I will never know what it's like to be a Black man in America. Me, Carmel. But I can read or listen to documentaries or watch or listen to podcasts, watch documentaries, listen to podcasts about the historical, social, and political issues impacting African Americans, especially Black men today, right? So instead of just relying on stereotypic images that I saw on the news growing up of Black men in criminality or in movies, I can try to understand the real lived experiences, either that set young Black men up for failure, or to understand that this is a stereotype, and actually the African American community is you know a lot more than that. To understand the nuances and the you know, the specific characteristics that don't necessarily align with the stereotypes. Um, so one way is to access different media, so different news stations, different TV shows, and even changing your social media so that you can have pages that you're subscribed to that portray cultural groups in authentic ways that don't perpetuate stereotypes. So one example is there's this podcast called Uncomfortable Conversations with a Black Man by Emmanuel Acho. And I find that really helpful because it really gets at the root of some of these stereotypic messages, and, you know, the validity of them, and, you know, how the perception even came about in society. So I think it's very important to just learn about what is going on with various groups of people. I'll give you an example, this very small example. During COVID, I picked up running because I like to get out of the house and get some exercise. So to keep me motivated, I was part of this, you know, online running group. And there's a guy who is part of my running group who's Black. And one time, you know, we were encouraging each other to run, and he said, "Oh, I actually have to go back home to get my wallet because I usually run with my wallet in my shorts that has my ID in it. In case I get stopped, I can show ID." And I was thinking, I have never had to think about that ever when I run, right? And maybe I should have, but that's just not something that's at the top of my mind like it would be for a Black man in America. So, so what are the issues that they're facing, but also what are the stereotypes that they're suffering from that are not necessarily true, and how can I learn more about that community? So, Jared, I know you have an example that you wanted to share.
Yeah, so it goes beyond just sharing about or learning about people's cultures. There's kind of the food festivals fun, or the heroes and holidays kind of approach, which is I just learn about kind of the surface level culture of another group of people. But there's also really understanding their true lived experience. And I think if someone brought this up earlier, an example, but one of the examples here in Santa Barbara, for example, is that we often talk about how students are doing in school, and as if all of them have the same conditions at home. And here in Santa Barbara, we've got a range of folks who are living in, multi-million-dollar mansions where they have their own room, their own space. They can find places to be quiet. They have access to great internet. They have access to computers and their own devices. And then we have families who are living 3-4 families in a single bedroom apartment. And what's the lived experience like of a young person who is one of 6 or 7 kids in a household that has 3 or 4 families, where that child is sleeping on the living room floor, where there is no internet, or there's very low speed internet, where they may not have their own device, when there may not be an opportunity to find any quiet time to do homework or study. And how does that compare to that child living in Montecito in one of those multi-million-dollar mansions? And so if I'm a teacher of those children, it's helpful for me to understand the realities of their daily life so I can better understand what kind of supports they may have, what kind of needs they may have, and what kind of barriers they have. So again, it's just, going beyond just learning about the food and the music and the other cultural aspects of a group of people to really understand what their experience may be like in our community or in our society.
Great, thank you. All right, so we're gonna send you into your breakout room so that you can tell us different ways that you expand your exposure. And I think, this is probably one of my favorite parts of the workshop because I learn a lot about what people do, what kinds of shows, movies, what kinds of interactions they have with other people, what are the ways that they go into their community to learn more about various groups of people. So I'd like you to just share those with each other, and then we'll come back and share them with the whole group.
So one of the things that I shared out was I teach a paramedic program, and we used to do the typical, hey, let's do a cultural day where you bring in different foods and all that stuff, and it was it was fun, but it didn't give them the opportunity to really truly understand the population that they were serving. So one of the things we started doing a couple of years ago is we actually go out to the homeless populations and work in the clinics and actually do, we're actually doing one this weekend where we go out and just serve the homeless. And I told the students, I said, it's not about doing any kind of treatment. You know, you're not going to start, it's really just sitting down and talking to those individuals and, you know, understanding kind of how they got there and why they got there and how you're there to serve them.
Mm-hmm.
And it's really made a huge impact on getting them outside of the, because some of these students have never even, you know, come across, you know, I mean, they've drove by them, but they haven't really got down and talked with them and figure out why they're there.
Yeah. Yeah, I think that's a great point, Bob, that it's not, again, like Jared said, it's not just about food, festivals, and fun. I mean, I think a lot of us have had like cultural day where we have, you know, appreciation of food and stuff, but it's more than that. It's like, what are the struggles? What are the injustices that they face? Like, can I actually understand what this group has gone through?
And the food festival fun, those sharing can be great for building connection, for socializing. You know, those can be great social activities. It's just helpful to recognize what they can do and what they can't do.
Mm-hmm. Anybody else like to share?
Our group talked about how traveling will help, you know, getting exposure rather than just getting what we're reading on the news or being fed by the TV or newspaper, or even in our communities with what we're comfortable and who we're comfortable around. Getting ourselves out of our comfort zone and traveling and experience cultures in person and actually living in different areas of the world, experiencing culture will help broaden our perspective.
Mm-hmm. Yeah, I think a lot of people are looking forward to traveling once we get the go ahead. But yeah, I think that's a great way of just really understanding, like immersing yourself in another culture to try to like live it yourself a little bit. Then you can really understand, you know, how other people think sometimes.
Like our kiddos are in Spanish immersion class. And so when we visit Mexico, we tell everybody as soon as we check in, please don't speak English to them. We want our children, we want them to really be exposed and really just experience the culture no matter where we are. And I was fortunate I had that experience. We had exchange students growing up from all over the world. And so I think we want to give that gift. I really do think of it as a gift to our kiddos.
Yeah, absolutely. I think
so I don't have the park situation like I was speaking to earlier, where I want them to experience it so I don't have to try to figure it all out on my own and make mistakes. Because
well, it's also important to think about these things for your children, not just for yourself. So, you know, I think that's admirable. All right. So moving right along. The next strategy is perspective taking. So this is imagining what it would feel like to be in another person's situation. So this is actually different from expanding exposure, because expanding exposure is really about learning about the big issues that face an entire group of people. You know, the statistics and the understanding and the nuances of the social, political, and historical issues. Whereas perspective taking is really understanding one individual person and how stereotyping affects them. So for example, what might it be like to be judged as lazy, aggressive, or even violent on the basis of race, right? So instead of learning about the African-American community, what is it like to be this one African-American man who is constantly judged as being those things? And, you know, this is a very, very powerful strategy. I would argue maybe the most powerful of the 5 strategies, because it emotionally connects you with someone. And it's really hard to stereotype someone when you're emotionally connected to them. Not only that, it helps assess the emotional impact that stereotyping has on them from their perspective. So I think this is really helpful, and it kind of reminds me of politics, because again, politics is based in these deep-seated values. And so, you know, if you really care and respect someone, you'll allow them to tell you their story. And so sometimes, you know, when someone comes along and has very different political ideology than me, I want them to tell me their story, because at the end, I may still not agree with them, but at least I can understand from their unique lived experiences how they got to that conclusion. You know what I mean? So I think it's very important to allow people to tell you their story so that you can at least try to take their perspective. We oftentimes talk about cross-cultural empathy, which is the idea of really trying to understand the cultural ideas and practices of another person from their lens. So again, my advisor, Stanley Sue, was doing therapy in mainland China, and he had a schizophrenic patient. And the patient said, "Dr. Sue, you have to help me. I stepped on the wrong piece of earth and a spirit jumped inside me." Now, he could have said, no, 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 that's not how schizophrenia works. It's a brain disorder and this is how it works. But he didn't. He said, "I will help you get that spirit out of you." Excuse me. Now, he didn't have to agree with that perspective, but especially when it didn't affect the outcome, he actually gained more credibility with the client by saying that, because the client's like, okay, he understands. And now the client can be more compliant. So again, it's not that you have to agree with the perspective, but you just have to understand it and try and work within that person's worldview. Okay, so I mentioned that perspective taking is one of the most powerful of the 5 strategies. So we're going to take a deeper dive into this one specifically. So we're going to have you work in groups to take the perspective of somebody else in your life. So that person is going to be the target person. And I'd like you to decide on an individual whose perspective you're going to try to take, and choose a target who has behaved or continues to behave in ways that make little sense to you, with whom you'll continue to have a working relationship, and who you need to be able to work with in order to perform your job effectively. A tip is to consider people you find frustrating or with whom you have regular conflicts. So this could be a student, a colleague, a supervisor, a friend, etc. So you don't have to write it down, but I'd like you to just commit to memory the name of the person whose perspective you're going to take, because I want you to commit to one person. I don't want you to jump back and forth between people. So I'll give you a few seconds to decide on a person whose perspective you're going to try to take, a frustrating person in your life. Okay, so while you're thinking of that, I'm going to tell you what you're going to do. So first, I'd like you to think of a critical interaction. So think of one interaction you've had with this person that illustrates just the type of perplexing behavior that you'd like to understand and that you remember clearly enough to describe to your partner. After reflecting on the interaction, identify the key behavior, belief, or motivation of the target person that you'd like to understand. If this individual is baffling or vexing on many dimensions, focus on the one you'd like to most understand. So I'll give you an example. Let's say that I'm preparing an implicit bias workshop and I have my undergraduate research assistant help me prepare the activity sheets. And I ask her to do this, and I get to the implicit bias workshop and there's not enough, they're not well done, and they're not going to work very well for the activity. That frustrates me, right? Because I took the time, I asked her to do this, and now I'm kind of stuck in the middle of the workshop. So the critical interaction doesn't have to be a novel. It can just be a few sentences like that. And then, you know, she also didn't tell me about this, so it kind of caught me by surprise in the middle of the workshop. So the key behavior, belief, or motivation I want to understand is, why doesn't she communicate well? Okay, so that's what I'm going to hone in on from that interaction. Why doesn't she communicate well? Now, we're gonna break you up into pairs, and each one of you is going to take turns being the speaker or the partner. So if you're the speaker, I'd like you to describe the target to your partner from your perspective. So discuss 1, the critical interaction, and 2, the key behavior, belief, motivation you'd most like to understand. As the partner, I'd like you to ask clarifying questions, listen closely, and ensure the speaker stays on track. Do not offer solutions, but note any biases that you perceive. So in order for the partner to note any biases, the speaker has to generate some hypotheses of why the person did what they did. And I'd like you to try and develop a stereotypic explanation. So in my case, I might say, well, one of the reasons might be because this student is a part of Generation Z, this new generation that's always on their phones and they don't know how to talk to people. And that's why she doesn't know how to communicate well, right? And then if Jared is my partner, the partner will then try to replace that stereotypic explanation with something that's non-stereotypic. So Jared might say something like, well, it could be that she's from Gen Zers and Gen Zers don't know how to communicate, but alternatively, there is also a power differential. So maybe she didn't feel comfortable talking to you because she felt like, you know, it would challenge you or it would be disrespectful, right? So that's sort of taking the situation into account. So I'd like you to do this.
The other person about like lack of consistency due to emotions, and trying to understand why the other person like can't block out their feelings, so that way they can focus on school or their children or whatever it is that is more important than, you know, getting caught up in your feelings or emotions.
Mm-hmm. Yeah, so just lack of consistency in their emotional stability, maybe. So their preoccupation with emotions is getting in the way of other things.
Yes.
Okay. Good. Okay, so now we're going to do the next part of the activity. Let me go ahead and share my screen again. Which is the perspective taking part. So in this part, we'd really love you to sell the other person's side of the story. So as the speaker, I'd like you to assume the role of the target person and retell the same critical interactions. Try to convince your partner of your newly adopted perspective, and don't forget to speak about yourself in the third person. So for example, if my research assistant was my target and Jared is my partner, I might say to Jared, okay, so I know that Dr. Saad is really upset with me, but I really feel like she didn't give me enough time to do this task. And I didn't feel like I could bring it to her because then it would seem like I was challenging her and she might have viewed that as being disrespectful. So really try and take the other person's side and sell it well. To make sure that you're selling it well, your partner is going to monitor how well you as the speaker embrace the target's perspective. Did the speaker sell the target's perspective as passionately as their own? And do you think the target would actually say those things? So we really want you to try and get in the head of the other person and sell their side of the story. So hopefully you had some rich discussions. How was it trying to take the other person's perspective?
It really forced us to think about the ways that their actions may be influenced, and like it was a little hard to be like, why are they acting this way, you know? But it was possible, and I got some great insight.
Great, perfect. Anybody else?
It was hard for me to come up with like the understanding part, like of why this person does the way the things they do, and trying to evaluate the situation. But once you get a little bit more knowledge about the person and the situation, it's like, okay, makes sense. That's to why the things they do.
Yeah, I think that's a good point because, you know, usually the next step after the steps that you went through is to gather more concrete information. So I might go to my research assistant and just say, hey, what happened? Or I might go to other people who she's worked with and say, hey, has she ever been like this with you? Or I might go to some of my colleagues and say, hey, do I actually not give my research assistants enough time to do their tasks? Right? So we can gather concrete information to try to fill in the gaps for us instead of relying on stereotypes. So in this activity, you got 24 minutes to do, to talk about these things. In real life, even if you take 24 seconds to try and adopt another person's perspective, I think it could go a long way. But the problem is a lot of us don't do that. So it's really about taking the time to be intentional in taking someone else's perspective. This final strategy of stereotype replacement is based on, again, the automatic assumption is just regular stereotyping. The correction here is to pause and to actively replace stereotypic responses with non-stereotypic ones. So this is a process that we refer to as detect, reflect, reject. So one, it's important to detect that we're relying on stereotypes. So, as I mentioned when we were doing the terrorist activity on Tuesday, we had a lot of time to feel the word terrorist come up, and we could recognize that came up for a lot of us. But as we're walking through the world, we're bombarded with all this stimuli. So sometimes it's really hard to even recognize that we've just relied on the stereotype. So to hone our detection skills is really important. To understand, okay, I'm catching that I detected on a stereotype. And then instead of to just shove it away and act like it never happened, do the opposite. Reflect on where it came from and how it's impacted others. So, did this come from media or friends and family? And how does it impact others in my past? So me as an educator, maybe I stereotyped a Muslim student. Well, maybe that didn't apply to just this Muslim student, but who other Muslim students have I stereotyped in the past? So what is the impact of my behavior? And then finally, actively reject it by replacing it with a non-stereotypic thought. So in the terrorist activity, for example, we said that most of the domestic terrorism is actually perpetrated by white men. And the idea, again, is not to replace one stereotype with another, but to actively dismantle the stereotype that you relied on. So if you do that over and over again, then replacing it with a non-stereotypic thought becomes a habit in and of itself, and it becomes easier to do it over time.
So we actually had you engage in some of this practice on Tuesday when we had you go to small groups and think about the messages that you were exposed to, the images you were exposed to while you were growing up. That's one way to kind of reflect on these stereotypes, which is a first step in rejecting them. But we also put together a worksheet that you can use. This is a tool that can help you really reflect on a stereotype and work through the whole detect, reflect, reject process, as well as work through some of the other strategies that Carmel just went over. So the idea here is you can use this reactively or proactively. Reactively might be that I'm going about my day and I noticed myself relying on a stereotype. I do the detection part that Carmel talked about. So either in that moment, if I have time, or later on that day, I can kind of write that stereotype that I detected in the first column and the group that it's about. And then I can use the 11 questions to really help me reflect on and ultimately reject that stereotype by just working myself across the page. So you'll see the top row has 11 questions. The next row shows which of the 5 strategies that question helps us get at. All of them deal with stereotype rejection, but some of them also deal with some of the other strategies. So in just a minute, we're going to have you practice this, but I'm going to kind of demonstrate how you might go about it. So you can we're going to have you pick a stereotype about a particular group that you learned at some point in your life. You don't have to believe in it today, at least not consciously, but just something that you've heard. And so, for example, I'm going to pick a stereotype. I'm actually going to pick one about a group that I'm a part of, which is Jews. So I'm Jewish, and one of the stereotypes I remember learning about Jewish people is that we are greedy and cheap. So I would write that in box 1, in column 1. I write Jews are cheap, Jews are greedy, as what the stereotype is in the group that it's about. Then I would think about where I learned that stereotype. And so for me, I would write down about how I remember seeing it in TV shows and movies that featured Jewish characters that were usually there for comic relief. And the comedy was built around the idea that they were cheap or greedy. I also remember hearing it from friends who either would say it outright or use phrases like, I'm going to Jew you down. In other words, I'm going to bargain you down. But again, building that connection between Jews and cheap. I also remember even in my own family making jokes about it. And I also can remember learning it in school in formal ways when, for example, in 12th grade in Shakespeare class, reading Merchant of Venice, which featured the character Shylock, who was very stereotypically greedy and cheap Jew. So I would write those things down in column 2. Then I would think about, what do I know about the history of this stereotype? Now, this is usually something that we often don't know, so we may have to do some research. I did some research when I was in college about the history of the Jewish stereotype and found that it really dates back thousands of years in societies that were Christian-dominated societies. Commerce was starting to grow, and so people needed the ability to borrow money. And in order to lend money and to eliminate the risk in lending money, people had to charge interest for loans in order to really accommodate the level of commerce that was growing. Now, those Christian societies, Christian faith often had a prohibition against lending money for interest. And so Christians couldn't get into that line of work. And yet the society needed the ability to lend and borrow money. So Jews living in those societies were often barred from a lot of positions. They couldn't be elected to government. They couldn't practice medicine or law. They couldn't go into a lot of different businesses. But Jews didn't have a prohibition against lending money for interest in their religion. And so that was a role that Jews were allowed to then play in that society, which helped them earn a living, but also helped the society. Now, over time, this idea, the knowledge of how that happened was lost. And the only thing that kind of remained was this connection between Jews and money and this idea that Jews are greedy. So that's a little bit about the history of that stereotype. So then I would just kind of keep going across the page. What feelings does the stereotype evoke in me? For me, it was shame, embarrassment. Going on like a couple rows later, what impact might it have on my behavior? For me, it had me kind of disassociate with my Jewish identity and kind of avoid being with other Jews because I didn't want people assuming that about me, and so on and so on. So what we're going to do is kind of give you a chance. We're just going to give you about 5 minutes or so. You don't have to complete the whole sheet. You probably won't in that time, but just pick one stereotype about one group of people that you're familiar with and see how far you can get answering some of these questions. I'd just love to hear from maybe 1 or 2 people about what it was like to think about a stereotype in this way. Was it hard? Was it easy? Did it lead you to any ahas or new understandings?
This is Nicole. I feel for me, it was much like Tuesday for me personally. It was difficult to actually write, to think about what's in my mind and then actually write it down. I felt pretty ashamed that my mind went there.
Nicole, I appreciate you being willing to share that. I think, it's certainly understandable. I mean, we as good people, we don't want to fall prey to these things. We don't want to think that we're susceptible to them. And, I guess what we just, say is kind of what we've said so far through the workshop, that shame, that tendency to want to just kind of distance ourselves from it actually can reinforce it. And so as hard as it is, it's so helpful to engage in a process of really being willing to write it down and reflect on it. Although doing it in private can certainly be helpful because then we don't have to worry about offending other people who might see it.
I mentioned that this workshop is based on the framework of Dr. Patricia Devine's Breaking the Bias Habit workshops at University of Wisconsin-Madison. And she, in her own institution, found that there was a gender equity problem in the STEM departments. So her and her colleagues actually divided the STEM departments in half. So half of them were going to be getting this workshop, and those were in the experimental group, she called them. And then half of the departments were going to be in these workshops later on, but not yet. And those were the control group. And what they found is that 3 months after the workshop, faculty in experimental departments who were trained felt more confidence and self-efficacy to promote gender equity than faculty in control departments. And what's interesting is this is even among male faculty. So not just female, but male faculty also felt more confidence to talk about gender equity after the workshop. But here's where the rubber really meets the road for me. 3 years after the workshop, 52% of new hires in experimental departments were women, compared to only 28% in control departments. And so if these strategies are practiced consistently, they can make a big difference in the field.
All right, so we want to move on now to talk about the institutional strategies. The strategies that Carmel just went over in terms of these 5 individual strategies are things that you can just do on your own. You don't need anyone's permission to engage in perspective taking or individuating. You don't need a budget or a policy approval to engage in any of those strategies. But these next strategies are really now talking about going beyond yourself, what can your agency do? What can your organization do? What can our healthcare institutions do to address implicit bias? And so we want to start with the first strategy of just collecting data, testing for bias, really looking to find out, are there disparities in access or experience or outcomes taking place in our organization or in our field? This might be looking at hard data, quantitative data to find out, are we seeing the same outcomes across all racial groups, socioeconomic groups, gender groups, sexual orientation groups, in terms of outcomes, health outcomes and quality of care. It also might mean collecting quantitative data, interviewing patients about what their experience is like, interviewing students about what their experience is like, and looking to see if there are differences showing up based on identity. And if so, then starting to ask those next questions about why might these differences be there? And what role could implicit bias be playing in creating them? It's especially helpful to look at disproportionality that is consistent with societal level disproportionality. So, for example, if we know that African-American women have higher mortality rates after childbirth, and we're seeing that same thing play out in our own hospital or facility, then there's a better chance that implicit bias may be playing a role. Another strategy is to really affirmatively state and pursue equitable outcomes. In other words, to adopt a position that says we are working towards equity in all forms in our institution, and we are working to eliminate racial and ethnic healthcare disparities, gender-based healthcare disparities, socioeconomic disparities, and so on. To state it formally through a written policy, to develop a vision, to develop a set of goals that are concrete, and then to make sure that everyone in the organization understands what that vision is, understand what the goals are and how we are going to get to them, and that the people are really clear about their own role in it so that there's no mistaking that this is what we are trying to do. Number 3 is to involve a diverse cross-section of decision makers at every level of the process. So we talked about this on Tuesday when we talked about the advertising, the Dove soap ads, and how could it be that these ads could kind of get to print and publication. And we talked about how perhaps a lack of diverse perspectives in the room may have contributed to that. Well, diversity is important in every situation, not just advertising. Research shows that groups that are more diverse engage in more thoughtful deliberation and discussion and produce better outcomes and problem solving than groups that are not diverse. And so how can we look at how we can create diversity in bodies that are making decisions in our organization, whether they're hiring decisions or policy decisions or whatever else they might be? How do we make sure that we have a diverse group of perspectives, a diverse range of life experiences around the table? And especially, how do we make sure that we involve people who historically have been left out of the decision-making process? Number 4 is to doubt objectivity and account for bias. So we've talked about this a couple of times. There's this idea that people like to think, well, I'm a pretty objective person. I know bias exists out there, but I'm objective, so I don't have to think about it too much. Or our agency is objective. We know that there are disparities in other agencies, but not in ours. And that actually undermines our ability to catch and notice our biases and to address them. And so what's more effective is to say, you know what, we know that bias is everywhere, which means it's probably within us as individuals and within us as an organization. So we're just going to assume that bias could be a problem, and we're going to take measures to disrupt it, to make sure, to reduce the likelihood that it will play out. And that might be implementing bias disrupting procedures and processes and structures like the kinds of blind processes that Carmel spoke about the other day, in terms of grading papers without knowing the identity of the person who wrote that paper, coming up with procedural checklists and rubrics that are very concrete when we're making hiring decisions or promotions or other types of things, or admitting students into a program. And so we're going to talk a little bit about just one area where this has already been implemented to great effect within healthcare.
Thank you. So, one area that I may or may not have mentioned on Tuesday, I can't remember, is maternal mortality. So Black women are 3 to 4 times more likely to die after childbirth than white women. And this is even controlling for all the regular factors, right? Complication severity and injury and all those things. And it actually holds true across Black women, no matter age, income, education, anything like that. So trying to understand how can we reduce this racial disparity. So what we see here is that Black non-Hispanic are much more likely to die after childbirth, followed by Native American or Alaskan Native, even though there's more variability in that group, followed by all races and ethnicities average, followed by white, Hispanic, and then Asian or Pacific Islander. So what we see here is that it also gets worse with age. So we see that, younger than 20, there's not that much of a disparity in terms of who dies after childbirth. But as you get older and older, you see that African Americans are more likely than other ethnicities to die. So what hospitals have started doing, as I mentioned, is taking the discretion out of a decision like that about, who gets operated on, who gets a blood transfusion. And some of the hospitals in California's actually been at the forefront of reducing this disparity in maternal mortality. And in some of the hospitals, including the one that I gave birth at, they would weigh the bloody rags after childbirth. So that way they didn't have to use their discretion to make a decision. And we know, so their implicit bias wasn't leaking into their discretion, but they made it a more objective policy of, if the bloody rags weigh over a certain amount, then that woman has to have a blood transfusion. It's not really in the hands, it's not up to discretion. So just implementing more objective policies like that not only signifies that the leadership team was doubting their objectivity before they put this objective measure in place, but that they wanted a standardized set of care that could potentially reduce this disparity. And that's exactly what happened. So if you look at the maternal mortality rate in the US in general, we see that California is much lower than the national average, and it's in part due to the narrowing of the racial disparity in maternal mortality. So these objective decisions make a big difference in reducing implicit bias on decisions and improving outcomes.
All right, so the next strategy is to educate a critical mass about bias. This means really reaching enough people in our agency, in our organization, in our department, so that we start to shift the culture around bias. We make it not only more acceptable to talk about bias, but even accepted, or expected. We make it so that people are encouraged to talk about bias either within themselves or when they see bias having an impact in the agency. It means developing a common language about bias, helping to kind of promote this idea about it's not about shaming and blaming people, but more about awareness and accountability, the kinds of messages that we've talked about in this workshop. It's about helping people start to develop the skills to identify bias and the skills to address it, as we've talked about this afternoon. So just an example of how raising awareness can have a big impact. The Ohio State University College of Medicine wanted to increase the diversity of its admissions pool. And so they had all of their admissions officers and their committee members take an implicit association test online prior to the next round of the admissions process. They found that all groups, when they took the test, displayed some level of, actually significant level of implicit white preference. And as they were then moving into the next round of admissions, 48% of the people reported they were conscious of their individual results as they were interviewing candidates going through that cycle. And 21% reported that knowledge of their IAT results, their test results, impacted their admissions decisions. And then ultimately, the class that they produced was the most diverse in the school's history. So by being aware that I do have bias, it helps me be more conscious about disrupting that bias in areas where it may impact my decisions. And the last institutional strategy is to collect data again and evaluate outcomes. So we said the first strategy was to collect data and determine do disparities exist in access, care, quality, education, and outcomes. And so this next step is, okay, we've now implemented all of the different individual strategies. We've implemented the other 5 institutional strategies. We've focused on improving the conditions to reduce the likelihood that implicit bias will get triggered. Now let's see what kind of impact all these things have had. Have we made any progress towards those goals that we stated? If yes, what can we learn from that so that we can keep applying it and do better? And if we fell short anywhere, what can we learn from that so that we can improve and get better? In other words, how do we develop a culture of continuous improvement and use data to guide us? What's important here is that we're not using the data to punish people if we fall short, but we're using the data as a learning tool, as a lens through which we can focus our efforts and refocus our efforts. So I just want to ask maybe for a couple of thoughts. Can you see any opportunities to apply some of these institutional strategies in your settings, in your work? Or if you know of some that are already taking place, we'd love to hear about those as well.
Well, my sister, she's a nurse at a hospital. And most of the area she works in is like a lot of like homeless people, and a lot of them will go in like constantly and like fake pain just to like get food because they have sandwiches and stuff. So that happens like regularly. So that can probably like influence her bias, because she's gonna be like, oh look, another homeless person, like I'm not gonna pay much attention to their like so-called injury because they're probably just here for food, you know?
Yes.
Sorry?
Oh, I'm sorry, go ahead.
No, that's all.
Okay. Yeah, so I think that's a great, opportunity to look at some of those individual strategies and say, am I starting to develop a bias against homeless people? Am I starting to develop an assumption that homeless people aren't actually in pain or don't actually need help? And then part of what I could also do at the institutional level is start to collect data and determine, well, does the data support that? Does the data show that the majority of homeless people coming into our hospitals are faking things? Or does the data show that actually there's a good number, a strong number, where there are actually serious issues that we need to deal with? So that kind of shows the difference between, how do I apply both the individual level strategy and the institutional strategy? And we definitely want to communicate that it's not an either or. It's not about should I do the individual strategy or the institutional. It's really actually about all 3. How can I do the conditions, the individual strategies, and the institutional strategies? All right, so, and these are the strategies. We will send this PowerPoint out to you, or at least a version of it with all of these different strategies that you can utilize. And like I said, it really is about how can we bring all 3 sets into our organization and into my practice in ways that they can build on each other and enhance our outcomes.